2019 Public Safety KCStat, and we will jump right in since we have a lot of goals and objectives to get through today. As always, we'll be live tweeting from at KCMO with the hashtag KCStat if you have questions or comments. So under this goal, we have 5 objectives and 4 to 5 strategies under most of those objectives, and so we're going to walk through all of those, mostly in order. These are the same objectives and strategies that we covered at the last KCStat in November, since the plan was last updated in October. So the first first objective we have is to reduce crime, and we have several different partners who will be reporting out on that. But first up, we've got the measures around this objective, which are primarily crime numbers and then also resident satisfaction. So Eric, you can go forward on. So just looking at on an annual basis, a fiscal year basis rather, crimes against persons from the NIBRS reports that KCPD puts out, 10 months through the year, through the fiscal year, through February. The projection right now, looking at, taking into account past trends, is an increase of about a little over 1% from the prior year, but that's still lower than FY16. That would be lower than FY16-17. Looking at homicides, summary for the year. This is on a calendar year basis, again from KCPD's daily homicide brief. Trending slightly ahead of where we were last year, or rather over the last several years, at 46 through May 3rd. And as has been the case the last few times we've done this chart, firearms by far the most common means of attack, unknown the most common motive, followed by argument. And the clearance rate on current year cases is 37%, with another 15% solved but not cleared. Crimes against property on an annual basis, again, looking at the 10 months of the fiscal year through February, and looking at past trends, that projects a decrease of almost 5% from the prior year, which last year was also a decrease. And then looking at resident satisfaction, so this is with 3 quarters of data. We actually just got the 4th quarter, so we'll be reporting out on that coming up soon in June. But on efforts to prevent crime is a level from where it was at the end of the last fiscal year. And that also holds true, I believe, for resident satisfaction with visibility of police in neighborhoods, leveling out. And then feelings of safety in both city and neighborhood is both leveling out from prior year. And then again, as we look at that by council district, you see substantial difference across the council districts in terms of how safe they feel in residents say they feel in their neighborhood, ranging from 39% to 79%. But feelings of safety in the city are a little bit more even across the board, ranging from 27% to 43%. And again, that's through the first 3 quarters of the fiscal year. So I think that takes us up, unless there's any comments on that data, we'll move right into Strategy A, which is to work with partner agencies to increase youth intervention and anti-violence programs. And first up here is Chief Smith from KCPD to talk about their efforts.
Good morning. We wanted to talk a little bit about our risk terrain modeling. This is a program we're bringing in from Rutgers University. We've had training on it. I believe we've been in front of some of the city directors also about what we're going to be tackling. This is an area to look at the city. It's geographical based. It's to look at areas that, places that we can solve issues that would deter crime from occurring in the first place. And many of that's through other things than enforcement. It's through codes, it's through lighting, it's through environmental standards, and there's some risk factors involved with people and other things like that. But we're going to be looking at this project. We have Rutgers coming back in June to look at our first reporting period and to see how we're progressing. Our IPI program continues. This we started last year. This is a really good program. I'm excited about this. These are kids that come in on their first day who will not talk to the police at all, and matter of fact say very negative things about the police, most of them. And this is our target audience. This is the people we want to get in front of, and this is kids we want to engage. By day 5 and the dinner, we're all high-fiving and first name basis, and then there's continued relationships with those kids afterwards through the Boys and Girls Club and events that they can go to that officers participate in with the kids, whether it's a game night or going to a ball game or something like that. We continue this partnership. We will continue it as we move forward, and we hope to expand it.
How many kids do you serve in there at a time, Chief?
It's about 15, 12, 15, something like that.
And how many times a year do you
We did it-
pull a class together?
In the year that we did it, there was 4. There was supposed to be 6, but our program director from Boston, Lewis, who is a great guy, unexpectedly died in the middle of the thing, and that really set the program back.
Yeah.
And so actually the Jay Paris, who started the program, actually came in to finish it because he wanted to finish the commitment, so he came in to finish the programs.
Good.
So we had a setback.
And on the risk terrain model, any more detail you can give about it? Do you want to?
Sure. So
tell me a little bit more about that, or tell us a little bit.
If you haven't seen the slide, what we use is a slide of an like a city park, right? And
Right.
You take away the slide, and maybe a couple kids won't come, but you take away the jungle gym, and then you take away this, and you take away that, and all of a sudden the park doesn't become an attractive place to go, and then other people use the park for other things.
Right.
So we look at that exactly the same way when we're looking at, hey, there's a gas station, there's this. What we look at the factors that bring risk up for crime, other than crime.
Right.
So gas stations, convenience stores, bus stops, street lighting, all of those things can have a perception of the neighborhood and what police could look for to say, hey, what can we do to improve this to deter crime?
Okay.
Chief, do you have those? And maybe Kate, you've got them. When Jonas was here, he presented to the directors, a couple Fridays ago. I think he sent a staggering statistic was 40% of all the crime in East Patrol takes place in 2% of the land area.
I think that's something like that. That's great.
So, to me, it's an interesting number. And then what we've done is asked, and maybe Kate and Eric can elaborate on it. I think we've asked for kind of the top 10 or 10 starting points where we can kind of assemble around those areas, those strategies, and start to work on them collectively, whether it's code enforcement, regulated industries, public works, whatever those issues are, and start to just systematically tackle it. But we can go after 2% of the land area in East Patrol and deal with 40% of the crime at the same time. That's a manageable way to get our arms around this crime issue.
I agree. And thank you for the support. I appreciate it. I think what's great about this program, one of the reasons we brought it here is because the other cities that did this, like Atlantic City, saw over 30% reduction in violent crime by tackling issues through this model rather than other models. So we're very interested in where this can lead, and we're very optimistic.
Okay, cool. Thanks.
You bet.
Let me ask you this. What do you need?
That's a loaded question, isn't it?
Loaded question. Loaded question.
I really, for the risk train modeling, we really need the city's support. We can't do this. A lot of these fixes will not be law enforcement fixes.
Right.
They're going to need outside resources, and I actually see potential for private-public partnerships in some of this.
Yeah.
But that's what we need. We're going to have to, and I've said this all, the police are not going to solve this crime issue. We all have to come together. I think you've said it 100 times.
Yeah.
We need to come together and say, hey, we have a bad corner here. What can we do to improve it? Who's going to take ownership of it, and who's going to work through this?
All right.
I guess Donna was telling me that the first meeting of that group is the 23rd of May to
Yes.
start tackling those target areas.
Yeah, great.
I think one of the things we ought to do is we ought to have like 50 cardboard cutouts of him and just place them strategically around the city. That'll stop people
I'm
from
sure,
coming.
yeah, that'll be it. Okay, social worker. Yeah, again, great support from the city on this program. Thank you. As you can see, just some things that we're involved with the social workers. I mean, every day they're out in the community working. So let me back up. I think one of the things that's not realized is how our social work program works from the onset. So the social workers are assigned to each division. Those social workers can only take referrals from uniformed officers. If Children's Mercy calls and says, hey, we need help with this, we refer them to whatever agency they need. But the referrals to the social workers in the station are for police officers in the field when they come in contact with family and other people that are in crisis and need help immediately. So that's how that program works. That's why they're out there in the community working, is to support our men and women who can't be that 5-minute fix. They come across an issue that needs more in-depth help, or someone needs more in-depth services than we can offer on a call for service. And that's what they're there for. So listed here are just a couple things we're doing just to highlight the different kind of work we're involved with through the social work program. All right. Again, I think we all can agree that a youth is a big component of anti-crime efforts, and it's just great contact. The FBI youth night with us at East Patrol was well attended. 371 youth. It was great. We had all the toys out there. DEA, FBI, Kansas City. We're all out there. Kids just roamed around. I was actually walking with the head of the FBI office here in Kansas City, and as soon as we get to a young person, we'd argue about why you want to come to KCPD versus going to the Fed. So, he would say we pay more. I go, you got to move, and we'd have a little debate back and forth. But it was a great night, and kids were very engaged in what we were doing. We had explored. We had kids come up from Harrisonville that wanted to know what the program was, and they came all the way up here to see what we had to offer because they don't have this kind of thing out there. So it was a really good night and a good mix of kids from our schools that were very close to East Patrol to all over the metro.
Good.
And then we're doing our summer youth camp also again this year, which was a huge success last year. And the last thing is we are looking to team up with the Scouts. We're in discussions now to start the Explorer program. We need a more in-depth program for some of our kids so they can get exposure to the police department, and really just some rules and some standards, like we want to buy them regular uniforms, dress uniforms that they're going to be in, they're going to have to maintain, and just kind of setting up for the culture if you want to be in the police department. And we're getting a lot of support from Scouting, and we hope to have this off the ground by next year.
Good. Outstanding.
Yeah.
Were you a scout?
I was not.
You were, weren't you? He was an Eagle Scout, I think.
No, I wasn't any.
He outranks you, though.
Oh, yeah. There's no doubt about that.
He tells me every day. Because you can't say it to me, he just says, I rank Rick Smith. He's kind of touchy that way. Thanks, Chief.
You bet.
All right, and so next up under the reduced crime strategy is some updates from our violence program coordinator, Kamisha Stanton.
Morning.
Hello.
So looking at our packet here, I have Money Smart KC presenting. They may be a little bit behind, so I'm going to move past that, and hopefully they'll get here before I finish.
Kamisha. Microphone.
There is a microphone.
There you
Yes.
go.
You guys hear me okay?
Yep.
Better.
Sorry about that. I think he's running a bit behind from Money Smart KC, so I'm going to move past that, and then hopefully he'll get here before I finish. So looking at the public service campaign focus area, we've completed that. That is iRise under the health department. And I think they'll probably present on that here in a little bit, maybe. The youth master plan is also under the health department, and I'm sure they'll be talking about that as well. They brought in someone to help with that program, and I'm sure they'll discuss that moving forward. Looking at the public engagement and mentoring program, so we had our last meeting on April 12th at Arts Tech. As usual, there was a resource share followed by trauma-informed care training. 7 organizations attended. So when I started, we had 27 mentoring organizations that I mapped in KC. Right now, there are 22 active. There are 17 that respond actively with the Mentoring Coalition, and we had 8 attendees to this last meeting. The first meeting had 11, and the second meeting had 7. So hopefully we can get some more participation moving forward. They're interested in having KCPD come, so we're talking with Jason Cooley because they want to start partnerships with mentoring organizations with them as well. So that's a goal for the future. The next meeting will be held in June, and I'll share the date for the meeting as we get closer. Looking at the Storefront Community Resource Center goal, last KCStat I talked about how we were interested in working with Choose Your Passion, which is Bill George's organization, to restart the plan to have a community resource center at Bluford Library. Currently, the community relationship manager, who is Johnny Waller, has began hosting community programming at the library. He has also started partnerships with some area agencies to help provide resources. They are continually doing community surveys to connect. Community surveys with residents to see what resources they need. I am working with him to connect him to the resources already available. So one example of that would be they were interested in, the survey showed that people were interested in getting toiletries and things like that. So I connect him to organizations that are already doing that work. So now they have toiletries and toilet paper and tampons and things like that to utilize at the library. In addition, with approval from the branch manager, Beth, I plan to work with UMKC School of Social Work to provide a part-time practicum student there in the fall to be an on-site social services resource. Another goal moving forward is to further partner with neighborhood associations so that Blueford can be a hub that includes them as well. Since our last meeting, Blue Hills has begun discussion and planning to become a community resource center in partnership with Kansas City Public School District. They've been working with Vince over at Combat as well. It's currently in planning stages, and so their initial focus right now is securing funding. They're hoping they'll be able to get funding from the Opportunity Zone funding program and the Neighborhoods Rising Fund because they're looking to open it at the Pershing School. So I'm helping them I'm hoping to assist them in gaining organizational and financial support. And the contact there is Cheryl Barnes. Looking at the interagency DV fatality review team's goal, the partners are all area DV agencies, the prosecutor's office, and the municipal court, and KCPD. Currently, Judge Weir and Jennifer Dameron from the prosecutor's office have taken over responsibilities in coordinating entities who are interested in participating. They have secured a name for the group, but they haven't secured what organizations are going to be on this panel. So they're moving forward, but it's just a little bit slower than what they were hoping. Looking at the CDC homicide study. So on you guys' desk, I gave you the information from the Missouri Violent Death Reporting System. The health department, myself, the KC Health Department, the State Health Department, the Missouri State Highway Patrol, and myself met in April to talk about the report from 2017. They submitted it in April, I believe, but they were still a little bit of ways from actually having the full report. And so I'm meeting with Councilwoman Justice on Thursday to discuss the Citizens Task Force recommendation and what the goal was specifically, and present this data to her and see what else we need. Then we can go forward to hopefully dispatching EpiAids. But that's a whole process that has to be greatly in partnership with the health department because they're the only ones who can just have that done. But the report's really good. There are specifics for KC on there on the first, and on the back of that first page, I put stars by it for you guys. But they have some pretty in-depth data that will be useful. We're hoping that at one point it could be more uniform with what KCPD reports. They said that they have a great relationship with them, but the way they report is obviously very different. So hopefully in the future it could be more uniform. So I don't know, is Ron here? Are you in the room? Because I don't know what you look like. Okay. Well, Money Smart KC, for the first goal, for the electronic database of community resources. So we talked about this in the past. They built that site out for the past 6 years. It is a heavily updated website. Every time I attend a meeting and map a new organization, they allow me to send that update to them, and they update their website. So that's currently the resource that I share with organizations moving forward as a community resource. They have a really good mobile site as well. And so hopefully in the future he'll be able to come here and do a screen share and map and take us through the website.
Great. All right, and so the last group to report out under this strategy is the health department.
Good morning. Cynthia Carlson with the Health Department. And before I get started, I just want to take this opportunity to introduce Dr. Marvia Jones. She just came on and is filling a critical role with the Health Department as the Violence Prevention and Policy Manager. Dr. Jones has worked in the areas of organizational development, strategic planning, and program evaluation for over 10 years. She earned a Master's of Public Health and a public PhD in Community Behavioral Psychology for the University of Kansas. And she also served with CDC as an evaluation fellow at the agency's headquarters in Atlanta, where she assisted with the rollout of national funding proposals, served as a facilitator for strategic planning initiatives, and developed violence prevention resources for state and local grantees. At the CDC, she gleaned firsthand knowledge regarding the needs and expectations of one of the largest and most influential funders in the United States. And also as a consultant, before she came to work with us at the health department, she was involved in the journey and the development of the Youth and Family Violence Prevention Plan, and had begun that work actually starting in early 2018. So she has been working with us very closely with the Prevention Institute out of California in the development of that plan. So as far as updates on that, violence prevention is not just crime prevention. And so it's really about collectively addressing the factors that contribute to interpersonal harm. So we're talking about individuals and relationship, community, and societal levels. And so those contributors are in multiple levels, different levels. And so when we speak about violence and violence prevention, it's more than just the news that you hear about where there's another shooting. It's also about the violence that occurs behind closed doors that people don't always talk about. And so that is why with the Youth and Family Plan, the focus is not just on community level violence and shootings, but it's also about intimate partner and domestic violence, child abuse, because all of those are contributors. And so we believe that all of these types of violence are rooted in trauma and the social norms that support that behavior. And so for this reason, when we talk about violence prevention, health, and safety, it's really about if you don't feel safe, you can't be fully well. You can't live the healthiest life, as we know with the zip code differences in life expectancy. And so that is the focus of the Youth and Family Plan. It's really about looking at what are the breadth of services that the city and contributors and organizations bring, and really looking at, but what's the depth of our impact and how do we start coordinating? And so as we go into, everything is interconnected. All of the outcomes that you're seeing are all interconnected, even though at the end of the day we get into our own cars and we go home to our own homes. So with the Youth and Family Plan, where we are at right now, the draft was completed at the end of 2018. That was when the work with Prevention Institute in terms of data and proposed strategies. We had some goal meetings in October where we met with different representatives throughout the community to talk about the different proposed strategies. The next step, and this is where we are right now and why we're very excited to have Dr. Jones join us, is the community input and feedback. So what we will be doing is having 100 conversations, and she'll go into a little more detail on that. But beginning this spring, we will start having those conversations, talking about the proposed strategies, and really finalizing that plan and what is going to be used moving forward. And then the intention is that we will have a full plan presentation and adoption of that in the fall, which will be coordinated with the adoption of the Community Health Improvement Plan. So that will be around August sometime. So with that, I will pass it on to Dr. Jones to take you through the next slide.
Okay, so it was actually that previous slide you were just on. Thank you. So what I want you to think about when you look at this slide is not all the different arrows in their directions, and that doesn't mean anything. What it's supposed to indicate is right now we have a system in Kansas City where multiple organizations are moving in different directions. So all of them have some sort of role that they play or some sort of way that they touch or impact the violence and trauma that Cynthia was just talking about, but we're doing it in an ineffective and inefficient way. And so what Violence Free KC as a subcommittee of the Health Commission has been focused on is really pulling all of the organizations together and getting into some sort of alignment around common goals around violence prevention. So we know, based off of research that CDC has presented in the past 5 to 10 years, we know that coordinated organizations working together in a coordinated way is a preventive factor for violence. We believe it has the capacity to reduce violence. So folks right now are measuring different things. We have different outcome measures. Some people are measuring how many people signed up for something, how many people showed up at a program. Other people are measuring actual outcomes, like how many people went through substance abuse treatment or how many people moved into a new home. But we need to get some sort of alignment around this and figure out what everyone is measuring and get that on the same page. Then thinking about the application processes that everybody goes goes through. So each different organization, as many of you probably are aware, may have its own process for even applying to get entry into their program. Well, for a family or a group of people who are already taxed and just traumatized by things that they've experienced and dealing with a lot of household stress, that can be a lot. So one of our goals is even to move them toward something that is a little bit more streamlined and simplified so that we can get better uptake in the community and we can move in a better direction. So we're really focusing on with the Youth and Family Violence Prevention Plan, this whole first goal of building a collaborative culture. We want to bring everyone on the same page, increase collaboration, trust, and sharing. So for instance, one of the things we're monitoring for this is in the future, after we've been doing really well with our intervening, activities and meeting, what would it look like to have more organizations instead of popping off and starting a new thing on their own? We should see, if we're doing it properly, we should see people coming alongside each other and coordinating, going after grants together, less competition, more collaboration. So that's that. And then for the next slide, so when we had these meetings in 2018 around the community, we were trying to really get people's input around 5 major areas. So where we live and play, where we learn, where we work, where we receive care, and then overall, how do we build effectiveness and overall sustainability? So today I'm just going to focus on kind of what's going on around that first one, which is where we live and play. It seemed to be one of the biggest or the strategy that had the most interest from people because it's neighborhood and resident based. I want to also clarify the health department is not the leader in all of the activities. So when it comes to early childhood development and healthy workplaces and where we receive care, we know that happens. So much of that happens outside of the health department. So we are really the conveners and the facilitators of other organizations around that work. We're not necessarily leading it. So one of the things under Goal 1 that we found was people were really interested in training and incentives for resident engagement in local planning, implementation, and advocacy work. So when we talk in our discussions, what came up was people wanting to understand how to get involved with the civic process. How do they advocate for better sidewalks in their neighborhood? How do they get on the PIAC or GoFund agenda or what have you. And so what we know also through the research is that in neighborhoods where people engage more civically and feel like they have a voice, we see greater neighborhood cohesion and we see reduced violence. So this is one of the things we're working on alongside the other efforts. Alrighty, so we can go to the next slide. And a point that so just a further point about the civic engagement, another key thing that came up was having people out, quote unquote, in the streets doing outreach. So I was interested in, it was interesting to me to hear how many people said, hey, with all the program work we're doing and all the sort of environmental change we're doing, we still want to make sure that we have outreach workers out in the streets close to engage with youth and their families. Next slide, please. All right. So in an effort to measure how we're doing with engagement at the neighborhood and resident level, we're actually using, in part, some of the data that you all already collect with the KC data, or data KC already collects, which is the percent of residents who participated in a neighborhood association in the past year, as well as the number of residents who volunteered. Our group just kind of chatting internally, we had some questions about like if people fully understood those questions and were fully responding. But at any rate, what we hope to see after we've really began working at the neighborhood and resident level, we hope to see that number rise. Again, that's just another indicator of civic engagement at a neighborhood level, which we know is a preventive factor for violence. And then same thing with volunteering. A couple things that we're kind of trying to plug and get your minds kind of thinking around early is this idea that residents would say that they believe that there are alternatives for youth and alternatives to violence in their neighborhood. Do they know how to settle a dispute basically without it turning violent, a conflict? Do they know where to go? Do they know how to mediate those peacefully? And then another question about people who say that their community doesn't tolerate violence and aggression. That's another social norm we're working toward addressing. So we don't have baseline data for those, but that's kind of where we're going now is trying to get to that point where we have that baseline data. And then next slide, please. All right, so this is, the image is not for you to read those words at all. It's really just so making a point to what Cynthia mentioned earlier about 100 conversations. That's not something new that I made up or the health department made up. It's a common community psychology term where you basically just sort of go around. The idea is that with enough conversations with enough influential people and groups, eventually you shift the narrative around a particular issue. And so what our goal would be for these 100, maybe it's 85, maybe it's 102, we don't know yet, conversations, is to really get people to say, we hear about your youth and family violence prevention plan. Here's where we can fit in. Here's what we're measuring. Here's where we can align with you all. Maybe it's not coming to a meeting, but it's at least signing an MOU that says we will work in tandem with other organizations. Before we start a new thing, we're going to make sure that we're in alignment with the other people who are doing similar things. So we haven't gotten the language solidified, but that's kind of where we're working. And then just sort of understanding overall what kind of technical assistance do people need, so that we can kind of move as a group in a unit instead of everyone doing their own thing.
And we want to just thank actually the mayor, because it was your charge to the health commission to create this opportunity for organizations to come together around violence prevention, looking at it at the community level. And so that is why we have had this opportunity, meaning the Health Department, Prevention Institute, and the Violence Free KC, because it is those representatives that you appointed. NOVA, the police department, Second Chance, municipal court. All of those have been a part of this development plan, as well as those 100 conversations. So, we thank you for that.
Well, thank you. Let me ask you a question. Are you guys working, collaborating at all with UMKC? I know that I talked to Chancellor Agarwal last night, and he was talking about their look at neighborhoods and social determinants and wanting to find a neighborhood to see if there was an impact they could make, et cetera, et cetera. And I don't know that he knows whether or not there was a collaboration between UMKC and our health department, but I certainly did suggest that there should be, because it sounds to me like you're working in the same types of space with looking at the same sorts of issues, and a collaboration there might bring some serious research and data and some resources to the table. Do you know if there's a connection there?
I've not heard of that.
I didn't think so, and I don't think that he thought so either. I'm trying to remember who he said was in charge of it, or who he was placing in charge of it. But I do think that there's an opportunity there to partner, and both of you then can probably benefit from the resources. You guys have, I think, a baseline of knowledge that they can't possibly have, but I think they may have some resources that we can't possibly have. So the combination of the two things might be good. How do you think it would be best to try to find out or hook you guys up? You want to do that? You want me to talk to the chancellor?
So with the Center for Neighborhoods, we have had contact as well as conversation. So we will just strengthen that relationship.
Okay, good.
Yes, absolutely.
Is it Dr. Dina? Is it Dr. Dina Newman? Because I know they're part of the process with Blue Hills and the data for that as well.
I can't tell you exactly what the name was. It was after several glasses of scotch.
Yes.
And a long night. But I can tell you that when I talked to him, he did not seem to be aware of the connection in any depth. So I wanted to make sure that there was somebody who was aware of it. Okay.
And in some ways, that's also part of these conversations, because what we have done is had touch points where we reviewed draft of the plan, and we've talked about the proposed strategies. So it's really a matter of going back, because this is where we're going to be looking at. Once the plan is adopted, then it's the implementation phase. And that's where people come with their agreements or aligning. And so that's where the true buy-in comes in, is that, we have to have those conversations and strong relationships, because it's not just health department, it's not just police, it's all of us working
the whole thing.
together.
Yeah, got you. Thank you very much. Appreciate it.
Are you guys done? Yeah.
Oh, well, just
Ochino.
third district, sorry, that one slide going back, just as kind of a very brief update. We are committed to still working with the third district. We haven't confirmed the date, but we are looking at a date in May to bring this task force back together. This was a task force that came out of a 3rd District meeting back in September of last year, and their focus is on safe and healthy community. And so we are just, again, as the convener, helping these community activists and neighborhood association members develop an action plan and next steps in supporting the concerns that they have for their district. So kind of aligning a lot with what we're doing here, and then I guess you could say in kind of exchange, we're asking them to review the strategies that we propose to make sure that it's going to be effective.
Is there a problem there? You said you're committed to still working with them. That sounded like maybe
Oh.
something come in the...
Well, I guess what I mean is that, as a task force, they tend to be short-term. It's not like a committee.
Okay.
And so just kind of helping them to develop those action plans and steps.
Sounds good.
For their district.
Are there any, is there any council involvement in that?
Yes.
Who's involved?
Yes. Well, Councilman Lucas and Councilman Reed had invited us, meaning the health department, to that 3rd District meeting in September. And so we just kind of keep them in the loop as to,
Are
the
either of them
development.
engaged in the ongoing process?
They have been, yes.
Okay, good.
All right, before we close out strategy A, I'm just going to circle back to, Kamisha mentioned Money Smart KC as a new database, new resource, and I think we have someone here from there who's going to do a very brief demo. Hopefully, just going to have you switch places with me. And
This is Ron Farmer. You can introduce yourself and give a little bit of background about the work.
Felicia, this is a...
Hi, this is Ron Farmer. He can introduce himself and give some background about the work he does with Money Smart KC.
Good morning, everyone. Thank you for providing me with the opportunity to speak with you this morning. As Kamisha said, my name is Ron Farmer. I'm the Vice President and co-founder of Credit and Homeownership Empowerment Services, or CHESS, Inc. I became involved with Money Smart KC in 2012. Money Smart KC originated as Financial Fitness Week in 2008, and since then it has grown from a week then to a month, Money Smart Month, in April, and then in 2016 we turned it into a year-round. Let's see if I can navigate here to the internet.
it's actually up here. If you want to type in.
It'll, okay.
Yeah.
All right. Just wanting to make certain I normally don't pack. Normally I just want to make certain something doesn't else pop up on there. Let's see. Typed in something. Will this? I can't see to clear it out. Okay. So, is there a?
IE.
Okay. Ah, thanks.
Don't like me yet.
And I will be brief. I'll make certain this doesn't take too much of your time. Okay. Okay.
Scroll to the right, maybe. Yeah, this screen's actually to the right of that monitor.
Oh. Okay. There we go.
It's very intuitive.
Okay. So let me go into some information about technical difficulties. I had the site pulled up this morning, so. So the website has a lot of really convenient local resources. We vetted these resources via through the Federal Reserve Bank, FDIC. We put together an executive committee. We went through, one of the reasons that this was put together was because we did a Google search. We did some research, doing a Google search on like credit help or financial help, Kansas City, and it came up with 1,600,000 resources. So that's, to the average person, that's very, very overwhelming. And of course, the first things that pop up are going to be advertised, things that are paid to be on these sites. So we vetted free local resources, put them together on this website with adult resources, teen resources, and youth resources. And the reason we separated them was because we wanted it to definitely speak to the audience, the target audience. If there was a youth that wasn't able to, their parents weren't able to access resources, if they needed food at home, if they knew that there was a single parent household in need of diapers or things like that, it would be easy to research. Oh, there it is, yes, thank you. So, and if you can scroll to the topics, and there's a drop down and then hit adult topics, please. So, I became involved through our organization because we work with folks with credit and financial issues, but there were other impacts that were keeping our clients from reaching their goals. So I became involved in 2012. Since then, Money Smart has rolled under as a program of Chess Inc. One of the things that it does, it helps us and it helps other community organizations, is it provides resources, wraparound resources that complement whatever it is that they happen to be doing. So in our instance, we were providing this financial education and helping with financial mobility for households, but if they were also concerned about consistency of food, consistency of income, or if they needed some kind of legal services they couldn't afford, those were, excuse me, things that were keeping them from reaching their goal. Excuse me. So this website and going year round was a good answer for them being able to find the resources, not only the individuals, but then the service providers as well, such as us or any other organization. Catholic Charities, Westside Housing with the housing, then legal aid, all sorts of resources are available to folks. So to give you, since I use most of my time trying to navigate to the website, I'll give you just a really brief overview. Since Money Smart KC website launched in 2016, there have been over 415,000 page views. This is all according to Google Analytics, so we have all of this data captured. That's views by over 69,000 visitors in 3 years. With an average of 5 local resources per page that they visit, that equates to just over 2 million times that local resources have been viewed in those 3 years. The average visitor to the website visits 6 pages per session, so they are staying on and they're looking at these resources. It's easy to navigate, very user-friendly. The different pages are written to the audience, to speak to the audience. And the other nice thing about that is, I'm going to get on the tech side because this is really interesting. The bounce rate is 2%. Now, the bounce rate means if somebody comes to the website and it wasn't what they were looking for, then they immediately leave. So it doesn't count as an impression. It's just a bounce rate. Average bounce rate for websites is close to 40%. So when people are coming to the site, it's what they're looking for. They're staying on the site. They're looking at 6 different pages. In relation, if this was a retail sales site, this would be a dream for any retailer to have folks spending this much time. Now, quickly as well, the website is built to include, be all-inclusive, all of the resources available in Kansas City. If there aren't resources in Kansas City, then there's some national links. However, it's very important to note that we also want to include all of the organizations in Kansas City. So it's not exclusive, and it's evolving. It's ever growing. So as new programs come out from different organizations or other organizations come on board, we're able to make this grow and to reach the target audience. Since the last 3 years, the most popular topics have been financial coaching and credit, so that's a very important part. But mentoring programs, immigrant services, parenting and childcare, and college and career prep and college funding. So these are all things that people are searching and reviewing and finding good resources for. Last year alone, in 2018, with Money Smart Day and teaching children to save. All of these things are incorporated in Money Smart KC. We had over 36,000 participants because of classrooms and the size of classrooms. And I definitely invite each of you to visit the moneysmartkc.org website at any point in time and look at those resources. And thank you.
Awesome. Good. Thank you.
Just a question here, and where's this tie-in with the violence-free KC program?
Oh, not Violence Free KC specifically. So with the Citizens Task Force recommendations, one of the goals was to have an electronic database of community resources because initially we had United Way that's not specific to KC. So initially I was working with Councilwoman Justice to see if we can build out a website, but then I found them and they had been doing the work for 6 years already. And so I partner and we have like a relationship with a staff member there, and I feed in resources that I locate so it can be a consistently updated website of resources.
Does any of this tie in with Higher KC Youth or with TNT?
Higher KC Youth is on that site, but
say
they haven't
on
worked
the site,
like as under their mentoring. Well, not mentoring, under youth services or teen services. They are on there as a resource, so they're tied to it, but they're not. It's not under TNT or anything like that. That makes sense. So
No,
they're
no.
doing it. So as a resource share, Higher KC Youth, it's on their site for youth services, but that's as far as a partnership goes with Higher KC Youth or TNT.
So there's no direct approach to the kids that are involved in Higher KC Youth to try to provide them with information about finance and that type of thing?
Oh no, not yet. That would
Is
be
there
yeah.
any such thing with TNT?
No.
I think there used to be.
Okay. Well.
You ought to explore that
Okay.
and see,
Definitely.
at the both of the TNT sites.
Okay.
All right, they'll be
that's a great idea.
starting sometime this summer. There's kids there,
Okay.
and they're the ones that I think you're trying to target. with
Definitely.
this information, and they're right there, and they're going to be there for 6 or 8 weeks. So
Okay.
may as well plug that in somehow.
Okay.
Okay, if you can.
Great idea. Thank you.
Thank you.
Thanks.
All right, so that's actually a really good transition because our next strategy is about increasing programming for youth.
Well, won't that be fun?
And so the first slide we have here is just about a little bit more about some summer youth programming from KCPD, just in terms of increasing programming hours, and I think it reflects ongoing collaboration with the Police Athletic League and Boys and Girls Club to provide youth access to those facilities in the summer. And then next up, we have Higher KC Youth to talk about the programming. So we have Dr. Kylie Larson here from
Hi, Kylie.
KC Social Innovation.
Good morning. So yes, I'm here to talk about Higher KC Youth. We've been lucky enough at KC Social Innovation to steward the Mayor's Summer Youth Employment Program, and we're very focused on making sure that all young people in Kansas City, not just those with ready access to economic and social capital, can find meaningful job opportunities in the summer that can then lead to meaningful career opportunities that keep them tied to the city and let them know that they can feel supported by the city that they live in. So our basic vision is that all young people are ready and connected for their futures. We started this work and have been steadily growing. So in 2018, we placed 256 young people in internships across 191 work sites throughout Kansas City, and we learned a lot through that initiative. So we learned where the breaks in the system are, and now we're trying to figure out ways we can remediate or put in interventions so that we can reach even more young people and ensure that they're having meaningful internship experiences, which means we need to support not only the young people, but also the employers who are doing the work. Because if any of you have had young interns before, it's not always easy to plug them into the workplace in a meaningful way that goes beyond filing or getting coffee. And we also want to do it in a way that makes sure we recognize how intersectional identities come into play in the workplace so that all young people feel supported and feel like they can speak up and have the work experiences they were hoping for, as opposed to the ones that adults always design for them. So we are really focused on having youth voice involved in the process. A couple of stats that we're pretty proud of. 71% of Higher KC Youth interns expect to achieve a graduate degree, And then 86% of our interns have found a new interest that they're interested in exploring because of that experience. And that statistic is, to me, important because it sort of speaks to this interesting longitudinal research that came out of the Baltimore area. But young people who have a spark or an identity project are actually more buffered against the effects of living in a high violence neighborhood or being faced with a high poverty neighborhood. So finding that thing that you're really into or excited about can actually help keep you on track, as the study says. The thing we're currently, actually, let's talk a little bit about this. So we've just kicked off our 2019 work, and that started with an internship summit. I was excited about the internship summit because it gave young people the chance to figure out what an internship is. You would be surprised by the number of people who just don't know, one, that's available, or two, what it actually looks like. So this was a chance for young people to come and get experiences with employers in a pretty low stress way. At the same time, it was a chance for employers to really see young people and to hear about their wants and their needs and their hopes. So here's a quick video that shows that.
We are starting a high school internship at Lawson. A lot of times, high school students, by the time they reach their senior year, they already know what they want to do in college. So we just wanted to start a little bit earlier and connect with students in certain school districts who might not have the opportunity to learn about Lawson otherwise. Hire KC has been amazing. They've helped us kind of design our program and figure out what would be the most meaningful experience for high school students.
So yeah, that's just a quick insight into the kind of work that we're currently doing, which is developing both young people and employers to make everyone successful. So I mentioned earlier that we'd recognize the gaps in the system. One of the biggest gaps that we noticed was that there was a disconnect between the students' needs, the work that high schools were doing, and the work that employers were willing to do in order to put young people into internship positions. So what's happening is basically opportunity hoarding, where folks who are in higher income school districts are better able to broker opportunities for their young people. So we're looking into and have adopted a technological solution that we think will make a nice first step into breaking down some of those barriers, or at least identifying what's happening in a way that is backed by data. It's called Launchpath, and it's basically a digital management platform. It's an open system for the region. It's a place where employers can list the opportunities they have around experiential learning in general. So that includes things like job shadows, are you willing to come to talk to my class, and do you actually have internships? It also gives them the chance to do some online oversight and evaluation of a young person's experience. So when they are done with their internship, they have a quick evaluation from their employer that sort of gives them insight to their strengths, their weaknesses, and where they can improve or what they might be interested in doing in the future. So for students, they have access to the internships, the jobs, and the projects that they're interested in. They can earn digital badges. They have ideally more high school and college mobility because they're seeing more opportunities. For employers, it gives them a chance to not be contacted by every single teacher in the region. They can list the opportunities they're willing to provide and sort of create one hub where they can do that work, as opposed to trying to do it across all of our many school districts and teachers. For teachers, those who maybe aren't as well connected or haven't had a chance, maybe they're new to the region, they haven't had a chance to build up the social capital, they need to leverage employer relationships to get their young people in there. They can come and find people who are willing to work with them relatively quickly. It also gives them a chance to sort of rate how their experience was and provide suggestions for improvement to the employers, and vice versa. And that's pretty much it. So that's what we're doing. We just launched. If you know anyone who would be interested in listing a job opportunity, please send them to Launchpath. You can find it on the Hire KC website. It's circled up there in the right-hand corner. The more opportunities that we list for young people, the more likely we are to start truly creating equitable opportunities for all young people in the city.
Have you had any conversations with the Civic Council?
Yes, we have. So we've been working with KC Rising, Sherry Gonzalez-Warren, on the sort of talent retention and development strategies that they're doing. Did you have something else in mind?
I was thinking of something more direct than KC Rising. KC Rising is a regional platform.
Right.
Civic Council is doing, moving to do some things with social equity.
Okay.
Perhaps you can give McLean Bryan a call
Sure.
at the Civic Council and see if you can get a short meeting with Mark Hill, the exec there.
Sure.
And see if there's not some way that they can help. They are bigwig CEOs of major companies.
Mm-hmm. We do have contact with them, and they have pledged to helping to share out the site.
share out the site is very easy. I could
Sure
do
is.
that.
You could actually, that'd be great. Yeah.
But sharing out the site doesn't feed the bulldog.
It sure doesn't.
Hiring kids does. And, you know, you might see if there's not some way to increase their participation in the actual meat of the program rather than the visibility.
Yes, I agree, Mayor James.
They can do something more.
It might be helpful if you have a chance to just put a bug in their ear about it too. That way we're coming at it from, you know, a two-pronged approach, as long as I'm asking for things. And I know that Carrie Keefe, our executive director, has been working closely with the folks there. The trick is, and this is something you're well aware of, people like to hire people they already know. And
Well,
what,
that's the whole problem with the city. The people who are in the ability to hire people only know white kids.
exactly,
That's not cutting it.
exactly.
You know, so they need to get out of that comfort zone and start hiring some people that they don't know. Mm-hmm. They don't seem to have. I'll leave it alone.
I
just
no, I
leave it
hear you.
alone.
We're in complete agreement.
Okay.
So we are working to make inroads on both of those
That's why
fronts.
the power structure is what it is. They only
Yes.
work with people you know, and you'd only meet certain people on golf courses.
That's accurate.
All right.
I'll keep that in mind. And I will also hook up with Kamisha, and we can talk a little bit about how we can do some more integrating financial literacy into the program, including one thing that we're piloting this summer, which is called our Project Commons. It'll be over in the new Keystone Opportunity Zone Center. So it's going to be for young people who didn't get hired for internships because maybe they weren't quite ready or they still need some experience. We're going to pay them a stipend and give them a chance to come and learn some work readiness skills and participate in some experiential learning opportunities so that they're actually leveling up, so that next summer we can get them placed into internship opportunities on a job site.
How many kids attended the job fair last year?
Last year I think we were at 300, and this year we were at about 550. So we're continuing to grow.
Okay.
All right.
Next.
So strategy C, or strategy E rather, sorry, is extending to communications with youth around violence. And so health department has just a couple slides to talk about that.
Yes, thank you. Just really quickly, so you all, or one of the business sessions, heard from some of the iRise youth. They attended to just present about some of the things they had been working on and what they had gleaned from this class. So just as a recap, iRise is a group of youth who work, who are part of a program through the health department where they're supposed to be ambassadors for violence prevention. So the idea is that they're in that age group that is at risk. So between 14 and 19, 20, we have youth who come together who advise on what should we post, what should the organization post about violence prevention? How do we best get that message out to their peers and colleagues? It's a part of another evidence-based program where the youth themselves are the ambassadors. So instead of the institution like the health department giving the messaging, you sort of do that in alliance with the youth. So right now we are working on plans to find funding to fund market research and the development of a more effective social norms change campaign. So I don't know if you've seen the one that FDA has for smoking prevention for youth. It's very, you could tell they really targeted a certain market. It's very targeted to urban youth. They really went in depth and interviewed kids to find out what was hot. I mean, as some of us age out of that group, we don't know what's hot and hip anymore, but there are people who are able to find that out, and they use that to make a special locally focused messaging campaign. So how do you make violence prevention and uplift and enterprise, how do you make that hip and cool in the neighborhood or in a community that really needs that? So
How many kids are participating as ambassadors in iRise?
right now there is a core group of about 8 youth.
And how are you measuring their effectiveness?
Yes. So what we have been doing in the past was measuring number of posts and reach.
The number of what?
Posts. I'm sorry, social media posts and how much engagement they had, interaction that they had with their audience. Right. That's kind of the baseline where we've been started. But where I would like for us to go and where we're moving toward is where we're surveying them at intake to find out what their attitudes and thoughts are about violence. So sometimes what you see is you see people say, well, violent, sometimes you just got to do what you got to do. So starting from that's, in my experience with, the group, that's kind of where people start. But after time in the program and engagement with the resources, what you get is, hey, there's always a better way. So we're measuring social norms change among that group, but also the social impact, the social norms change that they help in their peers, that they bring about in their peers.
How do you measure the social norms?
Yes. So that kind of goes back to a little bit of what we kind of forecasted earlier about those questions we would like added to the community perceptions. So it's the tricky part is getting people to complete a survey, right? Especially young people out, diffuse in a community. But what we're looking for are natural opportunities to do that. So, the idea is you get a baseline. Here's what most kids think now about violence and conflict. And if we're surveying them on a yearly basis, we should see some movement in those data.
Okay. Let me ask this question about the posts. Are the posts that they're making, Instagram mostly, or?
Instagram, Facebook, Twitter.
So then the posts are one thing.
Mm-hmm.
The responses to the posts
Yes.
are probably more important. What kind of responses are there? And are the number of followers increasing? Are the number of retweets, reposts increasing?
Currently, there hasn't been an increase. However, as we know, coming into the summer months, that is when violence tends to increase. So actually working with Violence Free KC is kind of that support. Mm-hmm. And also with youth, we have the Consequences of Gun Violence PSA that we created last year in collaboration with other departments. We are kind of relaunching that as that reminder that it's not just, death, but there are other consequences in terms of gun violence. And so we're going to be paying attention to the data so that we'll be able to report that out, especially over the summer, because that is where we really want to see some kind of push through social media to get that word out.
Okay.
So that's actually one of the things we would like help with is, so these PSAs have been developed. So the one Cynthia was just talking about with the other consequences of violence beyond just death, or in addition to death, it's just how do we get that out to people? How do we get that sent out? The health department has a limited pool of people to send it to, but if there was some way we could tap into cities' dissemination resources, that would be helpful.
Yeah, I mean, that, get us that,
Okay.
Colleen, we
Okay.
put it on across all of our digital platforms.
Have Chris Hernandez check in with Channel 41 on their Safe KC program and see if you can get something done there too.
Okay, thank you.
Or actually check in with the mayor or with the manager, because using the chain of command, you go to him and then.
That's fine.
That's not what he says when I go around him. All right, thanks. Appreciate it.
I do just want to note that part of the influence is not just through social media. So what the iRise youth have done is engage in multiple events, participating. They get invited all the time to participate in neighborhood level events as well. And then they have, as you can see with the partnerships, there are some entrepreneurs as well as others who are also part of that influence and working with the youth.
When they go to these neighborhood events that, I'm not sure exactly what that is, a block party or something like that.
Right. Mm-hmm.
Are they being received well, or are kids just ignoring them? I'm looking for something that says that this is having an impact.
Impact, sure.
And and if nobody is
Kids even
reposting,
there. When I go to block parties
Right.
I don't see a lot of youth. I see a lot of
older people.
a lot more of the established residents. I don't see the kids at those block parties.
Well, yeah, but it may be something other. I just pulled that out because I don't know what you meant by neighborhood events.
Right. Well, as you know, last year there was the music fest that we had at Power and Light, and so that was a great opportunity, and all of the youth with iRise were there, and they were received well. I mean, part of that is about that trust, right? It's those relationships, and so that is why it is about recruiting these youth who live in those neighborhoods and have that potential influence. And so, the reality is that they are also youth who need support. they are dealing with trauma as well. And so part of the programming here with iRise Youth Ambassadors is also helping to develop those skills for them and that resiliency in them as well.
Gotcha.
And then therefore they have that influence. So, and that is why we are looking for funding to bring in an agency that's really going to help push this to the next level. So as we are preparing for that, that's working with the youth ambassadors and helping to develop that.
I don't remember when it was, but I know it was at least a few years ago that I saw a program someplace in this country started by youth who were rebelling against violence in their neighborhood. And I forget what it was called, but I do recall that they started with a pledge amongst themselves to avoid violence, and then they had orange T-shirts or hoodies or something, which is the anti-gun violence color, and talked about how those shirts and the pledges had proliferated. I think there has to be an outward demonstration to people that something is going on that is positive before you are going to attract a lot of support from a private entity. They have to see, if I give you money, what's going to happen? Is it just going to be buried somewhere? So there really needs to be some outward push in a way that's visible and in a way that captures kids. And I think you'll find that there will be more kids. If I don't know, I'm not the expert. That's what you guys do. But I would really look for something aggressively outward and ask for a commitment from kids as opposed to simply talking to them. Sign this pledge.
Right.
And so you can put it on your website and say 1,000 kids have signed this pledge to be against gun violence or violence in their neighborhoods. And that way you can actually tell whether or not there's an impact. And kids tend to want to be joiners. So if they see 500, they may want to be 501 or 502. It's just an idea that you might think about.
Thank you.
Thank you. I appreciate what you're doing.
Okay.
What else we got?
Last strategy under this objective is going a slightly different direction about our new park ranger program to promote safety and stewardship in parks and facilities. And so Jeff Hurley's coming up to the podium here from Parks and Rec to talk about the implementation of that program.
Good morning. Again, my name's Jeff Hurley. I'm the park ranger supervisor. We're moving right along with our goals and objectives to get this program started. A few weeks ago, we did finally post the job to try to get some applicants, which we did. And last week, I did some interviews, and I'll be following up with those this week as we move forward. One of the other things that we have going on.
86 days.
I hope so.
Is there an age requirement?
There is not, and we'd love to have you.
I don't need to be in good physical shape.
Well, you have to be able to walk a little bit.
Oh, I can walk a little bit.
Okay. All right. You've automatically got a position. There's no doubt about that. One of the other things that we're working on right now is we have a survey out there that we're calling a pre-deployment survey that kind of will search for citizens' attitudes on safety in the parks and the perception of safety in the parks. And I understand that's being well used. That will be closed at the end of this week, so we can kind of take a look at that and figure out where we need to allocate resources in the parks. So that's going on. One of the other things that we're working on is we're trying to put together a memorandum of understanding with the police department. They brought up some valid concerns with regard to writing the park ranger's ability to write GOSs and some traffic tickets in the parks. And so I think that's being worked on now. I've taken a look at it and kind of approved it, as well as Terry Reinert, who's the director of parks. She's taken a look at it as well. And I think it's now in the police department's hands to have them take a look at it. So that's kind of where we're headed. I am looking forward to getting the Rangers out there as my name kind of gets around the community groups and stuff, and it is now. I'm getting pretty busy with meeting people and trying to get things going with the neighborhood groups. So that's kind of where we stand right now.
Who's going to provide the training?
Well, we're going to look at KCPD to provide training for get the Rangers out there to be able to kind of protect themselves should something go wrong, Other types of training, first aid and that type of stuff, we're going to have to reach out to maybe American Heart Association or other groups like that to provide that type of training. And one of the things that I did on the police department when I was there 25 years is I was a trainer, so I'll be providing a lot of that as well.
Cool. Thank you. Oh, was that, do you
That's
have more?
all I've got.
Okay. Thank you very much.
Okay, so it takes us to objective 2, which is about our emergency response delivery system. So we just finished our longest objective, and so now we're going to our second longest objective. And after this, it's all downhill. So, but we have several strategies in this section. We do have our measures of success. We're going to talk more about ROSC later on. But strategy A is about measuring the impact and effectiveness of the Kansas City Assessment and Triage Center, KCATC, which is run by Rediscover. And we actually have a new in this role to KCATC here, Lauren Moyer, who's going to talk through some of the data from ATC.
Yeah, thank you. So my name is Lauren Moyer, and I'm actually the vice president at Rediscover, and our new KCATC director is Michelle Kinnison, who's right behind you. So feel free to share anything that you have as well, Michelle. So thank you. So for those of you who are aware, Rediscover is a community behavioral health center. We offer an array of services, but we're especially proud of the work that we're doing with the Kansas City Assessment and Triage Center. Just a quick rundown of what the KCATC is for those who may not know. It's definitely a public-private collaborative partnership. I say that if it fails, it's on Rediscover. If it succeeds, it took a city to make it happen. So I definitely, yeah, and it's true. So I'm going to give you a quick snapshot of kind of what we see through our no wrong door on any given month. So basically we had in March, so that's our most recent data collection that we receive. And we do have an outside evaluator, so it's the Missouri Institute of Mental Health, which is a state evaluator. They're very well equipped to kind of really help make sure the data is very clean and gets it to us very timely. So we had about 401 clients referred. The average length of stay at the Kansas City Assessment and Triage Center has been about 16 hours. People can stay up to 24 hours. I think when we first started it, we had looked at models across the country whose maybe hours were like 7 hours, 8 hours. We're seeing such a high acuity with the individuals that are coming in that our true outcome is to have a very successful discharge plan. So it's not that revolving door that we're looking for. We're looking for true connectedness to ongoing care, whether that's immediate housing, immediate residential stay for substance use, linkage to job supportive development, whatever that might look like. We want to make sure that handoff is true and rich and important. 70% of the clients that do come through our doors are actually linked to ongoing care. So as you can suspect, a lot of people come in under the influence of a multitude of things. And so they're not quite ready that first time around. But we do, like I said, have a very strong engagement process on the back door, so we continue to try to engage them. We do a cost savings. I really like to use the word cost aversion. It's a very conservative approach to generating this cost number. We only look at the ones who were truly diverted from actually going to the emergency department, because as we all know, emergency departments still have to staff as they have to staff 24/7. So for just the month of March alone, the cost savings was $785,000 for 309 individuals. From January through March, so just the first quarter of the year, we've already seen a little over $2 million in cost aversion. So I think if we were looking purely at numbers, I think we're doing a pretty good job.
I have a question on the math. You've got 401 clients referred, but your presenting concern is 320. Is there
Yes.
where did the 81 people that
Right.
what happened to the 81 people that didn't obviously make it through the program?
Right. And so that's a great question. So that can definitely occur in transit. A lot of times, our highest saturated referral is the hospitals, which is great. However, that can come in a cab form. People can say, I'd like to get out on the side of the street. That show rate's about 20% no-show rate.
They're set by the hospitals, but they may not show up.
Correct. Yeah, so good question.
Do we have that issue with PD and fire, or do our folks actually, do we get them in the?
They actually bring them through the front door.
Okay.
Yeah. So, and that's another opportunity that while we are heavily saturated with the hospitals, I personally, selfishly would like to see a lot more referrals from the police and EMS, and I think we're continuing to have very strong collaborative partnerships to make that occur. But it is a no wrong door. They're in 10 minutes or less and back out on the streets. So just to show kind of our monthly referrals, this is our third year of being open, and we continue to see a steady increase in referrals, so anywhere from 30 to 40% increase over the course of the years as far as the referral base. The referral sources, again, if you want to go to the next slide, strongly Truman, Research, North Kansas City hospitals. We're continuing to increase and enhance our partnerships with EMS and KC Fire, as well as continuing our partnerships with the police departments. I think one area of opportunity is to continue to share the success stories and continue to make sure that we're at roll calls. Once you hear those successes, once you can have somebody share those internally, I think it's a more greater likelihood of actually continuing that referral. Again, we have a lot of collaborative partnerships at the KCATC, so definitely not Rediscover only. We have lots of ancillary service providers that we work with. Again, it takes a community, so a lot of our staff are in that brokering role of continuing to forge those partnerships ongoing. We continue to look at the top 50 lists of hospitals, KCFD, KCPD. Once we can target those high utilizers, those frequent utilizers, that's where we can show a significant increase. We had several examples, but I know one I think was transported, and I'm going to not be completely accurate on this number, but I think it was like 246 ambulance rides in 1 year. The next year was 2. I mean, that's a significant decrease. And again, I contribute that to our backdoor services, that strong collaborative connection and partnership of our case managers. One thing that we have identified as an area for growth is that we do stay at our capacity pretty consistently. Our capacity is 18 slots, if you will. We're not a residential unit, but we do have very nice bariatric recliner chairs. Again, we do have people that have stayed over the 24 hours. But again, that's to have that successful discharge plan. So much so, though, that we are currently looking for an additional crisis center opportunity, maybe more of an urgent care model, if you will, in our eastern Jackson County areas. Some of those hospitals, as well as opening up to additional police departments, has been desired. So we are looking at possibly opening up something in the Raytown location. You can go to the next slide. I've mentioned kind of that strong connectedness and support. So our case management is really kind of the crux of this model. Once somebody's been there 16 hours, what do they do next? We want to make sure they have a very warm handoff to care. We want them to get immediate housing. We want them to get their medications filled, not just leave with a script that they then go back to the ED and try to get filled because they don't have the funds to do it. So we really walk alongside people to actually make sure they get connected to those services. Another layer in our approach is that we have identified that there is a portion of our referrals that come in that, they really do need longer than 24 hours, and they have been kicked out of everywhere in our entire community, right? So what we've opened is a crisis respite that's located in the courtyard behind the Kansas City Assessment and Triage Center, and we call it the Thrive Center. Because we only have 16, there's a federal IMD rule that only allows you to have 16 beds at any given time under one roof. So if we could change that, that'd be great. But the Thrive Center, we really try to capture it for the folks who really can't go anywhere else. And so on average, the length of stay there is about 30 to 40 days. And again, that's a, continued modified medical detox approach, continued getting on antipsychotics, continuing to share with the community that this person's rehabbed and now can we place them here, here, and here that they've been kicked out of. Next slide. Again, just some additional resources. I mentioned that this was a public and private partnership, so we do have funding through Ascension Health, which was sell to local hospital systems, and then the City of Kansas City has been a huge, great partner with us, as well as the Department of Mental Health. And they've continued to help support follow-up funding. So when we have people that come through, 70% are uninsured that walk through our front door, they need a little help to get to that next stage. And so the Department of Mental Health has allowed us to have medication funds, housing funds, follow-up funds to give to centers who maybe have closed their doors to uninsured so that we can continue to get them the help that they need. So that's been a huge, huge piece of this. One other piece of this is, you can go to the next slide, is our hospital diversion program. It's called Emergency Room Enhancement at the state, but this program has been around since 2009. It started from a very small grant through the Health Forward Foundation, at that time the Health Care Foundation of Greater Kansas City. And it got on the ballot in 2013 for the Governor Nixon's crisis initiative to expand. And so our model in Kansas City was expanded to 13 areas across the state. And what that program is specific for is for those high utilizers. So it's the same kind of model. If you have somebody coming into your inpatient and EDs chronically, we have a group of folks who take very non-traditional approaches to care and get out there and figure it out. So that's been pivotal for the folks we're serving. These are just a few things. In 6 months, they definitely decreased reoccurring hospital visits 69%. They've decreased homelessness by 55% in as little as 6 months. So some great return with that program as well. So I think, again, we just continue to have an opportunity to address our larger systemic issues. While this is a huge help for our community, we continue to look at ways that all of our community mental health centers, all of our ancillary services have their doors a little bit more open. So we collectively hope that our data and our experiences that we're having can kind of help identify some of those ongoing barriers.
Thank you.
Yeah.
Appreciate it.
Thanks.
Okay, so that actually transitions really nicely into the strategy to measure the impact and effectiveness of KCATC has been in this citywide business plan for several years now, but in the last couple years we added an additional strategy that focuses on much the same issues, but bringing in additional resources and focus, and that is to develop initiatives to reduce the number of chronic users of emergency response services. So turn it over to Dr. Carney to talk about those efforts.
Good morning, Mayor, City Manager. I have a cold, so I apologize about my voice. I can't yell at you today. As an EMS physician, as an ER physician at Truman for years and years, I can tell you that talking about violence on the other end of these kids that are shot or these high utilizers is so important. So I thank you for focusing on that, and I'll continue to focus on that today. So on this slide, the top 10 users every year, we transport over 1,000 times. In 2018, our number dropped down to 900 responses because our top user was killed, and he was phenomenally using our resources. So whenever I look at this, is this bad medicine? Are we doing bad medicine? Are we doing the right thing for the patient? So as a physician at Truman, I look to see what happened to these folks that overlapped with Truman. Did we discharge them? Were they admitted? What were their issues? Why did they continue to call 911? And you can see that the majority of them call from multiple different locations. It's all over the city, north, south, east, west. The top 10 users on average have 35 different addresses from which they call us from. That to me says they're undomiciled. So again, it's north, south, east, west. It's all over the city. It's Midtown. And the studies that are out there show that pre-hospital personnel, if we take patients to a different alternative destination like a sobering center or KCATC, those patients can be sick and die. And so we are actively, as EMS physicians, trying to refute that data that's out there and say, no, they're not sick. They're not going to die. These sobering centers are actually the good medicine that these patients need. So that's why I went into each of these individuals, where they went, when they went to Truman, and how often they were discharged from Truman. So even though they called hundreds of times throughout the years from many different locations, the majority of the time, 100% of them were discharged to be back in that vicious revolving door cycle. Next slide, please. So what that tells me is that we all know we have to acknowledge EMS is changing. No longer is it the sexy, you get shot, let's adrenaline rush go and get you. Now it's long-term care. It's chronic illnesses. This is not what these providers train for. This is not what these providers sign up for. So our role in EMS and medicine is changing, which is a huge culture shift. The paramedic now manages low acuity illnesses. They now monitor chronic illnesses, the stuff that's more wearing. So on the state and federal side, this is starting to be recognized as well. Missouri, Medicare, Medicaid, treatment, no transport. So when you say TNT, to me, that means something else. Mm-hmm. We are potentially going to start getting reimbursed for not transporting these patients, which is another huge culture change. ET3, the EMS physicians, I was at a big national conference when the conference call went on. We weren't as pleased with it, but I think it's a start. There's a lot of stuff that on the federal side needs work, but at least it's being discussed, so I'm hopeful about that. Next slide, please. So why does this matter? Why are we talking about this? The repeat nature might suggest the outcomes are not improving. We are not giving these patients good care. It's a high cost of provision, just like Lauren had said at KCATC. An EMS ride and an ER visit, it can be a couple $1,000s of unreimbursed time and money, resources. It reduces our availability to respond to other 911 calls. For us, that's a big deal. And it impacts the morale of our EMS staff. Again, they signed up for something different. This is not what they signed up for. So I did an informal study at the St. Louis Fire Department when I worked there, and we were redefining trauma. I asked them, what is more traumatic to you? When your partner gets shot, which we've had happen, whenever you go to a multi-vehicle collision, many patients involved, or is it that chronic abuser, the homeless guy, somebody who's cussing at you? You have to pick them up 20 times a day, and you can guess which one was more stressful to our crews. So it's a negative impact on morale as well. They don't feel like they're giving these patients the care that they need, so something needs to change with them. The next slide just shows that vicious cycle. It affects everybody. Affects KCATC, the streets of Kansas City, our ambulances, our fire crews, Truman, because that's where I work at, and all of the other hospitals at the high utilizer meetings. Next slide, please. So under Assistant City Manager Donna Mays' leadership, we have had meetings called the High Utilizer Public Safety Network meetings, and the goal of these meetings is just what Kamisha was saying and the health department was saying, to get all of the people together, put all of the individual silos together in one room and talk about this. From Truman, I've got people from the ER physicians, ER case management. On the inpatient side, we've got it from an inpatient behavioral health, outpatient behavioral health. Truman Housing's involved. Our city qualified mental health providers, which we call the Qs, are at the table as well. KCATC just joined us at the table, and we're extending invitations to the court systems as well with the municipal court and then the mental health court. KCPD and CIT, these people cross multiple jurisdictions, and they ding the multiple jurisdictions multiple times a day. And so they're looking at multi-jurisdictional data exchange with MyRC, as I'm sure you're aware of. And then we've also got First Call and ESO at the table just to help share data, because again, if this patient's not at Truman, I can't look them up. And so there's got to be a way to kind of track them and see what's going on, where they're at, and what resources we can get to them. So next slide, please. A couple of the case reports that Lauren was talking about, as somebody who has seen these patients drink their lives away and limbs away. These case reports actually stick out a whole lot to me. I've seen these people go from visiting me in the ER multiple shifts. I see them every day. I'm at Truman. I know I'm going to see them there, all the way to 0 visits in a year. And it's not because they've died. It's because they're sober. They've gotten the resources that they need. So even though the case reports are so individualized, the care is actually occurring through KCATC and everybody at the table, and these people are becoming sober, and we're not seeing them anymore. And it's, again, not because they're dead. It's because they've turned their life around. So, and then same with the second case report. It's just another example. So the next slide. On the KCFD side, there's been multiple conversations of how we can contribute to this. We've looked at community paramedicine, mobile integrated healthcare. I'm very comfortable with both. I helped start both those programs on the east side of the state. Community paramedicine is a medic who's not in it for the 911 turn and burn. They're in it to go and take time with these patients. We've also talked to KCPD about their social workers and if that might be a potential for us getting a social worker or a case manager. Again, multiple conversations are happening and we'll see which one shakes out. The goal of this is, though, to better meet holistic needs of the patients. The patients don't need the ER. 100% of the time they're discharged. They don't need a ride to the ER. They need places like the Thrive Center and KCATC. So our goal with the community paramedics or social worker, anybody, would be to better meet those goals. Collaborate with primary care, because again, it's not ER problems that they're coming for. It's their diabetes, high blood pressure, mental health. Identify the gaps in the services. I'll tell you, if I can't get through the gaps of the services, this person who's homeless can't get through the gaps of the services. So this is somebody who would go with them and walk with them, hold their hands. And the cool thing about the EMS side of it is our guys go where these people live. So you don't have to come into the hospital to meet them. The community medics know these places. They know exactly where the hangouts are. They know exactly what the issues are. And so they go into these places with these patients and help navigate the system, establish those relationships, overcome barriers, and most importantly, return our crews to the 911 service. So that way we can be there for the multi-casualty events. So next slide, please. It is simple. There's people out there doing this, but it is not easy. You can't do anything fancy without improving the basics. So the goal is not to create something new, but to implement what is already going on. KCATC, KCPD, CIT officers, continuing to have these conversations under Donna Mays with everybody at the table. We have housing, we have mental health resources, we have inpatient, we have outpatient, we have ER, we have everybody at the table. So we're trying to have these conversations to get something formalized to actually affect these patients. So I don't think it's going to be easy, but we've got everybody at the table.
Right. Thank you very much.
This is one of my favorite quotes. Don't give up. I believe in you all, no matter how big or small, because I'm small. It's a Dr. Seuss quote.
I love Dr. Seuss.
So my next thing I get to talk to you guys about is cardiac arrest and survival of cardiac arrest. The first slide is the resident satisfaction with quality of EMS services. This is a slide that Kate puts in here. I don't know.
Yeah, so I mean, I think this is just where we're able to bring our resident survey to bring to bear on some of this. So what this shows is we have, continue to have very high satisfaction with people who their perception of our EMS services, and actually, if those who say that they've used EMS, about 13% of the residents are even more satisfied. So than the ones who just have a general perception. But another piece of insight we get from this is that when we look at this against household income, we find that there's a direct correlation or an inverse correlation with household income. So in the lowest income group that we track, it's 20% of residents, and in the highest income, I think it's less than 10%. So definitely illustrates the disproportionate use of the system and the resource needs that go hand in hand with that.
That's a beautiful transition. So the first slide is the measurable outcome of ROSC, which is return of spontaneous circulation, which means we've been pounding on your chest, you're dead, then your pulse comes back, your heart starts beating again.
It's pretty graphic.
Yeah, thank you. That's what I'm going for. Unfortunately, if you ask any healthcare provider in the room what happens when you get a pulse back, 100% of the time you lose the pulse. It's not necessarily the measure that we're looking for, especially me, because I believe in our community and I believe that we can save lives here, which is what I'm going to talk about. I do want to highlight, though, that for this year, fiscal year 18 and 19, our ROSC, which is the pulse comes back, 55% is the highest it's been in years.
Good.
So I want to pause on that and celebrate that and thank my crews and the healthcare family that's watching right now. Thank you for your good work in that.
Why? Why such a jump between 17, 18, and 18?
You know,
and
it could just be a fluke, but we'll talk about that.
Okay.
We'll talk about that. So I am pushing EMS, as all EMS physicians are, to say that the new standard of care is survival. Not just getting the pulse back, but it's neurologically intact survival, which we'll talk about on the next slide. So for years, my office has been reporting, next slide, please, thank you. For years, my office has been reporting on the survivability by category. And if you hit the next slide arrow, I've got red arrows that I want to bring your attention into. So you've heard me talk about this twice now at the previous KCStats, but the Utstein bystander survival is the one I want to focus on. And the reason why, it's the most likely to survive cardiac arrest. And we can do something about it. We can make a difference in this category. So the Utstein bystander survival is survival of a cardiac arrest patient who was witnessed by a bystander. So city manager, if he dies, mayor, you witness it. But not only do you witness it, you get an AED. You realize that it's a shockable rhythm. You deliver the electricity. So you're doing CPR, you're intervening as a bystander, which for us, when you call 911, gives them way more of a chance to survive.
They've taken the mouth-to-mouth out of the CPR.
They've taken mouth-to-mouth out, so you don't have to kiss them.
I might help you.
So back to the previous slide, please. So again, the reason I'm focusing on it is it's something that I believe that we can improve here in Kansas City, and it's going to take EMS, the hospitals, and the bystanders. It's a multifocal approach that is so important, and I cannot get this message out there enough. Our survivability is less than the national percentage, and it has been, and it's continuing to go down as you track it across the years. So in 2018, our Utstein bystander survivability was 19% compared to the national average that was 37%. On the calendar year of 2019, we're even lower at 0.07% survivability compared to the national average of 19%. Our numbers are very low in this category because, again, it's a very specific type of death. And the cardiac arrest registry is just that. It's a registry. So we rely on hospitals to put in data. So the data is not clean or statistically significant. It can be adulterated data in the sense that it's hard to make a statistical significant decision based off of it, but we can definitely trend it. So as you can see, our trend is going down, and we're going to talk about why I think that is.
Well, let me ask you a question. I mean, between the KCFD and the national, are you looking at the same data there?
Yes.
So that's comparable.
It's comparable, except the number is much different. So on the national, you're looking at thousands. On the KCFD side, you're looking at hundreds.
Right, okay.
And so for us, one death, that percentage will change vastly compared to a bigger pool, if that makes sense. Okay.
Yeah, it does.
So I went ahead and explained the Utstein bystander survival and why it's so important, so we can go on to the next slide. So hit the over arrow for me. You'll see that, again, my message is our bystander CPR rate. It continues to fall. Our citizens are dying, and the ones that are witnessing that are not intervening. And we're going to talk about that and what to do with that. So the next slide shows that the AED use continues to fall. The blue line's the national average. The green line is our city average. So only 5.3% of our bystanders get an AED.
Let me ask a question about
Please.
AEDs. How expensive are they?
You can get them for free.
Really?
Yes, but there are stipulations in the city ordinance to people who own them. There's certain criteria that make it very strict. And so we have already discussed this at EMSCC with fire chief and everybody at the table about changing a little bit of those requirements to make it easier. So if I gift a church an AED, that church might not be able to actually use that AED because of certain ordinances that are in place.
And with regards to CPR training, where is that offered?
We're going to talk about that.
Okay.
We got slides on it. Yeah.
Okay.
I'm excited.
I'm ahead of you.
All right. I like it.
I'm a doctor too, you know.
Yeah, we all are.
Juris doctor. Nobody ever calls me doctor.
I'll call you whatever you want.
Really?
So the next slide just highlights that this message has to get out to the community. Next slide, please. Help me say that this is not okay. We need to be better than 0.07%. Raise the red flag, sound the alarms, let's save some lives. The time is now, because this is life and death, and we can do something about it. So the next slide just re-emphasizes what I've talked about at previous KCStats. Cardiac arrest is a community issue. 4 out of 5 of you are going to die at home. And we're going to talk about the discrepancy in the zip codes that Kate helped kind of introduce earlier. So 90% of you are going to die before you get to the hospital. And just because we get a pulse back when we get there doesn't mean you're surviving. So this is a community issue, this is an EMS issue, and this is a hospital issue. It's a Kansas City issue. Shortening the time between when you die to a bystander intervening is paramount. And that is where survival comes in. So we looked at tons of studies. Dr. Joe Salomon was part of these studies, and we know that if you're in a low-income neighborhood, you're more likely to die, but less than half likely to get bystander CPR. If you're Hispanic or Black, you're 2 to 3 times more likely to have an out-of-hospital death, out-of-hospital cardiac arrest, but only 18% of you are going to get bystander CPR, which is even less when you look at certain zip codes here in our town. So next slide. I love Dr. Chan's quote, which is why I keep it in here. It's not race or wealth that makes you more or less willing to save a life. It's just how prepared or unprepared you are to do it. So it's not that people don't want to help. It's just they haven't been prepared to help. So with Dr. Martin's help, whenever she was at the health department, we used the spatial epidemiological clustering technique to identify our highest risk neighborhoods for out-of-hospital cardiac arrest and lowest provision of bystander CPR. And we want to target our education and resources on that, which from the fire department, we will have people speak on that. So the next slide shows those zip codes. And then if you hit the over button, I just put a line in there to show you that it's all east of 71 Highway. Most importantly, all of these zip codes had a median income of less than $40,000. 5 out of 6 of these zip codes were greater than 80% non-white. So it goes into exactly what everybody else is saying. They're the highest risk zip codes, the areas that we need to focus on. And we're going to talk about how we've been focusing on that. So Deputy Chief Walker is going to talk about his public outreach to some of these zip codes.
Hello, everybody. Okay, so what we've done with the fire department is change our concept of our public education that we've had for years, and we've attacked it more aggressively, and now we have an outreach program. So starting last September, we have trained over 1,200 people in hands-only CPR. Now, that's the new method of doing CPR. When we've been out in community groups, I have to tell you that we've had really positive feedback. Last week, 2 weeks ago, we were at the Clyce Community Center with 40 seniors, and they were really amazed when I said, "Hey, everybody here can learn CPR." And one of the questions was, "Do I have to put my mouth on somebody?" And I said, "No, that you don't have to put your mouth on anybody anymore, just your hands." So we've gotten a lot of positive feedback with the hands only, but we started our CPR hands only CPR with City Hall, and we hit 450 employees. 29 floors in 29 days. So how this ties in with our smoke detector program is that when we track, we're using one of the IPP, which we'll get with that company to be able to see the areas most in need of smoke detectors. Well, these happen to overlap with the areas in which hands-only CPR or cardiac arrest rates are high. So with our aggressive, we have gotten out to community groups. We've gotten out to we're working really intimately with the community centers. We've done, next slide. Nice. And this just kind of gives a background of, we do what we do in the Fire Prevention Division, and that's within the outreach office. The 8,500 smoke detectors in the last couple of years, but if you look at that, every time we go into a home, now we take a packet of information, which includes information on hands-only CPR. It's got information on home fire safety checklists. We're trying to be comprehensive in how we get out into the community, and really, like I said, we're working on being proactive instead of a reactive organization. Next slide, which would be as an example of our interactions, on April 20th, we reached over 2,000 families, and that was in 3 events that we worked, which were Easter egg hunts, one of which was with the Jackson County Sheriff's Department, where we were there, we had tables set up, we gave out information on hands-only CPR and our free smoke detector program. If you wanna, and this is...
A free blood pressure checkup was just one of the services showcased here at Coffee with a Firefighter at the Brush Creek Community Center. 1:30 overnight today. It's part of the Kansas City Fire Department's new community outreach.
You know, for 150 some odd years of our history, we always respond, but now, we're trying to get out in the community and let them know, be proactive.
Yummy. While enjoying free coffee and donuts, you could also learn how to get a free smoke detector.
And you can make an appointment for whatever's convenient for you. And we'll just come out and install it for you.
Or learn CPR.
We want to get as many people trained in CPR and the new CPR, which is, we don't know mouth to mouth anymore. We want to let people know that, you just got to push on their chest.
Deputy Chief Jimmy Walker says more training equals more lives saved.
The sooner we can start resuscitation efforts, the higher chance you have of surviving cardiac arrest.
With recruitment down slightly, these events are also a chance to reach out to future firefighters. KCFD just lowered the application age to 18.
We want to try to get people straight from high school and get on to the fire department and just really try to have our fire department represent what the community looks like.
Emily Welsh, KMBC.
Okay, so that's one example of what we're doing, but we've been really aggressive in trying to get out with these groups. Neighborhood associations, we're doing police department CIO officers are really great about this. We're partnering them with, we're having an Ivanhoe neighborhood association meeting. They're having like a block party, so we'll be there. We're going to set up a table with CPR dummy and just train people every half hour to get small groups through. So let's look at the smoke. Next slide. We can look at our zip codes.
Next slide, please. Jimmy,
there we
I'll
go.
talk on this slide here, but you stay up there. So if you click through, I highlighted the highest risk zip codes compared to Deputy Chief Walker's. And there you can see 435 and I-70, and then a red circle around both of them. You can see that the smoke alarm requests for 2019 overlapped with our highest risk zip codes. So whenever his office in KCFD goes into these houses to do the smoke alarm installation, now I'm in your house where your loved one will die 4 out of 5 times.
We don't say it like that. We're not trying to scare people, but I mean, we do tell them.
We're all gonna die. But
The nearest part,
I'm sounding the alarm.
We're
It's
going to
time.
die in your home. Be
Yes.
careful. No, we don't.
4 out of 5 of you, and then greater than 90% of you are not going to make it to the hospital, and it's time to change that because we can and we will. But if you circle his smoke alarm requests compared to my highest risk zip codes, the overlap is phenomenal. It's the same amount. It's the same group of people.
We're not trying to give them a heart attack while we're there, though. So we put it in much softer terms. But when we're there, as you can see, KCFD's been doing a smoke detector program for over 20 years, but we've never tracked who we've given smoke detectors to.
Next slide.
So now what we're doing is we're going with future tracking. So in the IPP, we got hooked up with Geospeza, and they are developing we're using it right now. We're tracking all of our smoke detector installations, and we get information, demographic information about how old people are in the house, languages spoken, age of the people, like I said. But we're also tracking all of our public outreach, all of our training, hands-only CPR. So, we're really working in the future to be able to have hopefully by next year. I know some of you won't be here, Mr. Mayor, sorry. But
He'll still be alive,
he'll
though,
still be
right?
alive. There's a 4 out of 5 chance he's going to die in the house by next year, though. So I don't.
Wow, this is getting grim.
Yeah, but
I'm just thinking I want to go now.
But we know CPR, hands only. So anyways, we're just tracking all of our public outreach and information. So hopefully that we can come back next year with Dr. Carter. Next time with Dr. Carter, we can have more comprehensive information on what we're going to do.
Well, I'm really not surprised that where this area is, this is where a lot of stuff is.
Yeah.
So it's not unusual.
No. And now we just have the data to support that,
Gotcha.
to support what you're saying. So the future direction and goals, like Chief Walker was just saying, is targeting these high-risk zip codes. Please, if you have connections, help us get into Kaufman, Arrowhead, on the news. Hands-only CPR is the message that my office wants to get out
What do you
there.
want to do at Kaufman and Arrowhead?
I want to put a video up there.
There's not very many people at Kaufman right now.
Oh, yeah.
Well, they're out of town. We'll just leave it at that.
Yeah.
But you want a video?
I want videos. I want everybody to be aware of this issue. You have got to do bystander CPR.
We have
because
we know some people.
beautiful,
But
beautiful.
I insist that I be brought back. Survive.
Yeah, we'll make
Just-
that happen.
Thank you.
Yep. Come to Truman, promise you, we'll make that happen.
I
So,
live close.
and then of course Nixle next door, and then on the KCFD side. So next slide, please. From my office, we had the very successful rollout of the new protocol, policy, and procedure packet with support from the fire department. This went live in October. So what that means for me, as from a science standpoint, our benchmarks are improved. So now we have one packet for all of my providers to be working off of, so that can improve our performance and quality measures. And then we are looking at improving our documentation for our crews overall. Looking at dispatch for pre-arrival instructions, and with Jason Shear's help, we're looking into a bunch of these very elementary measure points that we can start with good data.
Do we have the video already? The PSA video? Do we already have
I've got videos, yep.
But do you have
Yes.
one that if they said, sure, we'll play it next week, it's
Got it
already
for
ready
ya.
to go?
Yep.
Where can I find it?
I can give it to you.
Please.
It's in my email.
All right, please.
So CARES, that cardiac arrest registry enhanced survival that I was talking about, I'm also the Region A medical director, and so with state EMS in the region, we're getting CARES for every agency in the state of Missouri. So I can only compare numbers with some good friends kind of under the table, like, hey, here's our survivability, what's yours? And we can kind of shoot a text back and forth, but I don't have access to their data. When everybody's on CARES this next coming year, we've got a pilot program where every agency will be on CARES for 2 years. We can ourselves look at the St. Louis Fire Department and compare our fire department to their fire department and really see where we're at. I always think education is an important cornerstone. I want to continue to work on our education at KCFD, working on increasing our skills in simulation. We've been working with the professional development division for that. We've introduced what's called a cardiac arrest call review. So every single cardiac arrest that occurs, good, bad, indifferent, gets reviewed with a supervisor. It's non-punitive, it's just educational and a discussion. Hey, what do you think about this one? Let's do it. So on the KCFD side, we can improve, and then on the community side, we can improve. And then I'm talking to the hospitals as well. So, and then of course I've got a picture of an ultrasound in there. There's always new, fun, fancy procedures that we could potentially look at implementing. And so we're looking at the evidence-based medicine that's out there and what we can do to improve our survivability. So in conclusion, on the next slide, help me help you. Let's save some lives. We can do it. I believe in us. Our numbers can only go up from here.
Cool. Thanks.
Doc, did you get we talked a couple months ago about a kind of a new training protocol with some dedicated folks. Has that been implemented, or do we still have more work to do on that area?
What was the question?
We were gonna have some, I think we had talked about creating some dedicated paramedics that would act more to do more of the ongoing training.
Yeah, we're using some of the ADCs for
Yeah,
that.
okay.
So our
Going
ADCs,
okay?
we've had very positive feedback from that. Our ADCs are our EMS supervisors who are out in the field, so they have been the ones that are doing the call reviews that go to the crews.
Okay.
And then I would still like to get skills and simulation, which we've had great conversations about that. So, yeah.
Okay, last strategy in this objective is a very short one, and transitioning from talking, I guess, about lives to about lives and money together. So implement the GEMT program, and we just have one slide on this. And
I'll take this one.
Joe
My name
came
is
out of
Joe
nowhere.
Coleman with the fire department. Yeah, I sat over here instead of walking up over there. The bottom line up front to this slide right here, May 17th, 10 days from now, we'll receive the GMT reimbursement for a net pay of $6,709,616. So that's kind of the bottom line on this one. And then we'll start this whole program again with the cost report. They'll be due November 30th of this year, which will cover the from July 1st, 2018 to June 30th, 2019.
Good.
And then the last thing on there is that the Missouri Health Net Division, they will be going out and doing audits on all the cost report settlements for all everybody that's in the GMT since this is the first year that they've implemented it, to make sure that, you know, everything is being accounted for and it's correct.
Okay, thank you.
Okay.
You're welcome.
Okay, moving to objective 3, which is a brief one. Improve the diversity of employee recruitment, succession planning, and retention in the police and fire departments. And so measures of success here about percent of a uniform or sworn personnel who are women and or minorities. And so tracking that over time. Eric, you can go to the next slide. From KCFD's standpoint, this is data pulled by HR as of just this last month. So on the left-hand side is uniform, or in this case defined as fire union member. On the right side is non-uniform, which is a smaller group, which may be union but not fire union. And so you can see the breakdowns there. The top half in blue is males and the bottom half is females. Going to the next one, which is KCPD. This is, again, from their summary that they do on a monthly basis from March. And numbers look relatively similar here. You see, again, sworn on the left side and civilian on the right. And then strategy A here, don't think we have any updates on this. This is the ongoing one about the staffing study. So going to strategy B, talking about developing partnerships with local educational institutions to increase entry-level public safety workforce. Next slide. And there's just a couple points in here from KCPD. I know the chief had to leave, but that just noting that they have focused their recruiting efforts in historically diverse areas and have conducted visits and job fair attendance at 10 events since November. So then I will turn it over to KCFD to talk about their recruitment efforts.
Thank you. Dr. Richard Gist, Principal Assistant to Fire Chief Gary Reese, and Deputy Director of Fire. With me is Deputy Chief James Dean, who's representing us now as our Executive Officer for Diversity, Retention, and Recruitment. And James is leading us on these proposals. We'll have a few words to say about them as we go through them. The current Academy class, the one that is right now in field training, is one of our most diverse classes in years, containing about 44% protected classes. The class we have coming after them meets that standard and more, and is our most gender diverse class we've had in a long
When you
time.
say protected classes, that's
African American, Hispanic, Native American, and in our case we look at gender representation very heavily as well, in that women are notoriously underrepresented in the fire service. We're actually, compared to many metro fire departments, we are better represented, but there's still a long way to go on that issue. Accordingly, we're making a great deal of effort and putting a great deal of attention on this. I mentioned before Chief Dean being assigned here. In our last recruitment period, historically, the fire department has recruited about 2 months out of every 24. That is, we've had people standing in line desiring to be on the fire department and thousands of applicants, and our position coming in has been often to whittle down that pool into the 100 we might hire in that brief period. We flipped that on its head now. All fire departments are facing different recruiting strategies and different recruiting challenges than they have before, and our numbers are just not what they used to be. But more important, we're working very hard to make sure that those numbers come to represent the kind of people that we are looking to mirror the community we serve, and finding those people, helping them develop, helping them enter our profession. So in this last recruitment period, we focused very heavily on outreach to kids who were coming out of high schools in areas that we were underrepresented, and making it possible for them to come and be a part of that testing process. In this case then, rather than putting a strict, the age requirement used to be 19, we said if you were going to be 18 by the time you graduated from high school, and you were graduating in this cycle, we would test you in this procedure. That way kids would not have to wait a year after high school graduation and be delayed another recruiting cycle. We could catch them and bring them in early. We've also established a new standing committee in our labor management partnership directed specifically to increasing our diversity, retaining diverse members of our department, and recruiting on a year-round basis. That is, we are now focusing our recruitment efforts, like our outreach efforts, on constant presence in the community, on building the KCFD brand, and on attracting people who may never before have thought about joining the fire department to consider this as a career, and a career with a great option for serving your community, staying within your community, and making positive change. Can we get the next slide, Kate? Next slide. Oh, I got it. Damn, okay. That's what I get trying to look out the corner of my eye. Hey, one of those things we've been working on for 2 years now is partnership with VOTEC programs to try to get kids who are in high school and have not selected a career to think about joining the fire service. The strategy has been to try to enroll them in an EMT class that would build up over that course of a year, get them to hold a state EMT license, and then we have positions to offer them as apprentices while they develop and build their skills and develop their overall suitability to fit the fire service culture, get into a training class, these sorts of things. In 2 shots with using Manual Tech Center with KCPS, we've been able to graduate about 18, 20 kids, but so far they have struggled to fill that state testing requirement, to actually pass the requirement for state testing. We've done several things. We've put mentors volunteering from the fire department in the classrooms with kids over the course of the year. We've helped them get access to the testing methods the state use, which are very different than what most urban kids see in a classroom. It is called competency-based testing. It tests for cognitive skill level. So essentially you go in, they start firing you questions until you fail 5 in a row because they're looking for the highest level at which you punch. But it means you will fail more items than you will succeed on, and that's...
An oral test?
No, it's written. It's computer-driven. The kids do very well on their practical skills. They're able to meet the practical skills requirement, but they struggle on this. The problem with that is, as EMS providers, practical skills are if we point to a leg and say, put a splint on it, you can do it. The cognitive skills are, can you look at that leg and decide that it needs a splint? So there's a lot of work we're doing there, and one of the things we're working on now is putting together both Kansas City Public Schools, Manual Tech, with Prep KC, with which a number of you may be acquainted, which has had great success in some healthcare-related programs in helping find the right students and build them up. We're also pushing back our recruiting efforts to get kids earlier so that they have the prerequisite courses that will help them succeed in EMT rather than just being thrown into it as kind of an option off a menu for their senior year. We've also expanded the reach of where we're looking to include the Herndon Center, the VOTEC resource for districts in the southern part of the city, who is in their 2nd year of offering an EMT program. And I think, in fairness, to show you the struggle we're having, note that in their 1st year they couldn't get a kid to pass the state test either. Now, they're looking better in the 2nd year, and we may be able to pull as many as 5 Kansas City residents out of there to put in the apprentice program if, in fact, we're able to make all the legal things come together. And we're working on that right now so that we can get these kids before they drift away. But we're also looking at other ways to build out, working in common with Penn Valley Community College and their EMS people, and all the ways we can possibly build up that entry-level element. The bottom line is that we're committed to continuing this work because we believe these are the people who can serve this city, and we have a place for them to serve it well. So that's Chief Dean's area. Give him a minute just to tell you quickly about some of the things he's working on.
What I'm trying to do is to make it a culture, and as Jimmy Walker said, when we go out in the community, and we have an opportunity to serve the community in many ways, smoke detectors, also do continuous chest protocol. We also want to use it as a recruitment opportunity. And I think that one of the best ways to do it is when you engage with community groups, faith-based group, neighborhood organizations on an ongoing basis. We want to identify those people who might be able to influence our kids, because sometimes I know in my case, and maybe in some of you all's case, you need someone to tell you, hey, this might be something that's good for you. That worked in raising some of our numbers when we advertised this last time for our recruitment. We advertise on some of the radio stations that target urban youth, 1590 and KPRT, Magic 105.7 and 95 The Buzz, and we got greater responses. We also used the data where when they enter certain zip codes in the urban areas where we wanted to particularly reach numbers at a higher percentage, they got something on their phone, a message on their phone that indicated the fire department is hiring. This is what you need to do to be able to then apply for the fire department. So we're trying to do intentional interaction. Anytime we interact with the community, which we're going to increase, we're going to be recruiting all the time. It's not going to be something that's done only on a 2-year basis, but it's going to be ongoing every time we interact, which is going to be also exponentially increased. With almost anything in the community, we find out we're going to partner with those community organizations so that we can then let them know what is available and how our process works and how it has changed, so that we can grab young people when they're young, when they come right out of high school, and that, of course, they don't have to go get any additional training. We will train them and give them everything they need to be successful to join the fire department.
Great, thank you.
Okay. So moving on to objective 4, which is to increase effectiveness and efficiencies of operations at municipal court in order to achieve the best possible outcomes for those served. And we've got our measures of success, which Megan, our court administrator, is going to be touching on a little bit more. So I'll turn it over to Megan. Yeah, you can go to the next slide.
Go to the next slide. So we've talked a lot about the 10 core tools from the National Center for State Courts and how we can begin to measure those. You will notice that historically we've only measured really our clearance rate and our time to disposition rates. We have recently added the age of active pending caseload, as well as our trial date certainty measures to measure. We're also working really hard right now on our access and fairness, ensuring fairness on legal obligations, legal financial obligations, as well as our court employee satisfaction. So once this is done, we will have 7 of the metrics, or 6 of the metrics that are really applicable to 6 of the 7 applicable metrics we'll have measured. I'm really looking forward to hopefully maybe sometime next year we'll be able to work on that last one that we'll have, which is our actual cost per case. And we'll be able to measure that. So just to kind of highlight, since the pending caseload and the trial date certainty, those are brand new, so just kind of getting a baseline of it. So 72% of our active caseload is less than a year old, which is kind of a good measure that we're actually disposing of the cases in a timely manner. And as well as our trial date and certainty, there were 86% of the cases that were actually set for trial were disposed of on or before that date. So we're not, when they get set for trial, we're not getting them to be continued, which then inconveniences officers and the victims and witnesses that come to that trial date setting only for the case to be continued.
Megan, is there a standard for those, kind of a national standard?
We're looking into that. The core tools, we just were able to get this actual data for May late last week, and so we haven't really compared that to kind of our other courts and our other metrics, but that's what we'll be doing as we go through this year. So kind of some of the big things that the municipal court has going on. We've been working really closely with Data KC and Bo on the plain language. So you can see on the left-hand side is our old payable summons that was sent out on anything. We have looked through it with a plain language lens to make it a little bit more visually appealing, to make it a little bit more informative to those. And so we're running a sample on the summonses that were mailed out over the last 2 months. And so we will be examining to see which one of those people that got those summons, which one of them actually appeared in court
hopefully at a higher rate, is what we're thinking, that because they got that information, they could understand the information, it looks a little bit better. On the next slide, we also added a back page of printing to talk about kind of just some simple FAQs. You know, how do I get to the courthouse? How do I, what happens if I just need more time to pay? You know, how can I handle those situations? Do I need to get an attorney? So just some simple FAQs on the back to hopefully answer a lot of their questions, maybe decrease their calls into the 311. The other big projects that we have going on is the National Center for State Courts has selected the Kansas City Municipal Court as one of the 6 courts selected for a pilot project to work on community engagement, where they have partnered with the University of Nebraska Public Policy Center to help these 6 courts kind of come up with a toolkit that they can take nationwide for helping to improve the court community trust. So on this next slide, we kind of talk about what we're really looking at is when we're looking at kind of understanding, enhancing the public's knowledge about the court, what we do. Fairness, to uncover any biases and perceived inequities with the court system, as well as access to improve our court user experience. And hopefully with all of those together, then we can build that trust between the court and the community. I think so many times people think of going to court as a negative thing, and what we want to show through our understanding, through making sure that we have great access and fairness, is that we can actually help people and we can actually get them the services that they need if they come into our court system. One of the things that we're working on in the next slide is our timeline that we're working on with them. So you'll see it's kind of an 18-month project. We'll hopefully be done about mid-June 2020. One of the things I want to highlight right now is the court user survey. We've never done one. It's just kind of an access and fairness study. So we have chosen this week, May 6th to the 10th, to do a access survey. We're asking anyone who comes into the court to complete this survey. It's about a 2 to 3 minute survey, about 30 questions. We were pleasantly surprised. We thought we were looking at having at least 400 people over the 5 days complete the survey. Yesterday, just our first day, we had 269 people complete the survey. So really excited to get that information, see what it shows and what we can improve upon. But I mean, it has a lot of things, just from, how easy was it to find the courthouse? Was there adequate parking? To, were you treated fairly by the judge? So there's a lot of really good questions that were asked. So I can't wait to get the results from this test and see what we can do going forward.
Great, thank you.
Okay, the next strategy, which is about developing a long-term funding and housing strategy for incarcerated detainees and sentenced persons with municipal infractions. And so Donna Mays is going to speak to just one slide on the latest update to this.
So good morning, Donna Mays, Assistant City Manager for Public Safety. And so, as many know by this point, June 25th is the last date we'll have municipal detainees and KCPD arrestees and sentenced folks in the Jackson County Jail. And so on June 26th, we'll be transitioning them into some temporary solutions that we have been able to develop some contracts with a couple of different places. We've reached out to multiple counties and jurisdictions to see what housing solutions or bed space they would have that they could make available to us. And in that search, we found 50 bed spaces at Johnson County, Missouri Detention Center, which is in Centerview, Missouri, about 10 minutes this way of Warrensburg. And with that space, we'll have housing for 50 long-term sentenced inmates, and that'll be broke down in 25 male beds and 25 female beds. So these will be the people that have a sentence that don't have multiple visits back to the court and or don't have additional services. They have not volunteered for any of the alternative programs that the municipal court offers, such as drug court or domestic violence court or mental health court or that sort of thing. The other piece of this is our contract with the Heartland Center for Behavioral Change, and that's at 1514 Campbell, and they are currently a halfway house, but they have an open space that they are making some significant changes to, where they've had contracts in the past with Department of Corrections and Federal Bureau of Prisons, and so they're creating space for us there where we'll be able to house 135 people, and that will be made up. I'm sorry, 110 people. Sorry, 110 people, and that'll be made up of 85 spaces for municipal court detainees and sentenced people, and then also 25 spaces for KCPD arrestees. So if you can see our current situation, we have 175 bed spaces for municipal detainees and post-sentence, and then KCPD has 100 bed spaces, and they're kind of broke up male, female. So we really have some stopgap solutions right now. We don't have any permanent solutions. We're working towards permanent solutions. We have some ordinances before council that we're looking for approval on that have not been approved yet. And then we're looking at alternative solutions or additional solutions to this for temporary space for the KCPD arrestee piece, because we really feel like we're kind of short and inadequate there. And KCPD has been reaching out to other partners to see what is available in the area and or what some temporary housing solutions might look like.
So 275 beds, were there 275 people in those beds?
So not all the time, but so the municipal court, their sentenced population is, their average is about 157. So as an average, yes, sometimes they hit those maxes. And then the bigger issue is looking at the male and female division. And so that's where the municipal court has had to go back and do reviews and releases because they may hit the maximum number of female spaces, or they don't have overflow capacity because sometimes they send them to Platt for that. So the average has been about 157 for municipal court.
All right. Okay.
Okay. Last but not least, Objective 5, prevent animal-related threats to public safety and support animal welfare. And again, we have our measures of success on pet licensing. And the first strategy here is focused on increasing those license numbers. So turn it over to Patrick Ebery to talk about this information.
Good morning, Mayor.
Good morning.
City Manager, good morning as well. Good morning. If we look at the chart, it shows March 2019. We don't have the April numbers yet, so I anticipate a slight increase in the total numbers of licenses that we have in Kansas City. Because this past summer, we had programs like interns. We had 4 interns who actually were making phone calls to pet owners with expired licenses. So we anticipate increase in the numbers based on that effort that was put in by staff and the interns as well. And if you can move to the next slide, it basically shows the pet population. We get that number from the AVMA pet ownership calculator. Shows a number of dogs at 108,134, cats 118,133, and if you break those numbers down by the current number of licenses we have, it pretty much equates to 11%, 20% for dogs and 3% for cats. We, if you can move this slide.
How do we know these numbers of dogs and cats? Who counts them?
Yeah, it just guess the estimate, I believe.
Or are you counting council in that?
I wish I had the right to be a part of that, Mayor. Go from house to house and do the counting on it. Anyway, next slide. Spay and neuter Kansas City, SNKC, they continue to be our best source for increasing pet licenses. The last contract we had with them was, I think the total number was, amount was 14,800. And that contract was for them to provide about 1,000 licenses. I went back and checked on the numbers. So far, based on the returns I received from them, total licenses sold was about 952. So they pretty much meeting that target, So because of that, we decided to increase the number, the contract amount. That's what we're currently working on right now. My goal is to increase that number by additional 500. So if you're looking at 1,500 licenses, that should, based on my calculation, that should increase the number from 11% to actually 12% in terms of licenses sold in Kansas City. I mean, in terms of pet with licenses in Kansas City. So I would encourage, I certainly hope we will continue to partner with the SNKC, short of going door to door, which we certainly don't have the staff to do. That's the other way we can increase licenses. So this is the best shot we have right now, so we'll continue to do that. If that is more money in the budget, allocated in the budget, I would hope we will increase that as we transition to, never mind.
Okay.
Okay. Let's move on to the next slide.
I can cover these. So SNKC had a number of events around the city, and so we thought we'd map out where their customers of these events were coming from. So with the exception of the first map on the left there's a white star on the rest of these. That's where the event occurred. And then the dots represent where that animal resides normally. And you can see that most of them tend to have a geographic concentration, but really no matter where you put them, you're going to be pulling from basically the 6 zip codes we were talking about earlier in the EMS section over in the 3rd District of Council. So I thought it was rather interesting. You can see also kind of a historic Northeast concentration. So a lot of success in pulling from those areas. And then if we go to the next slide, the 2 maps on the left update. I kind of grayed out the ones on the right. They're from the previous slide. Same thing. There is a concentration, but you can also see that they pull from remarkably far on some of these. So the map on the left, yes, more customers were nearby, but quite a few came from fairly far up north, I would say. So
What's an event? When you say
do you want to describe these events?
Just the event is to microchip.
I mean, but when they say that spay and neuter has an event, what's that mean?
It's a low-cost event where people bring in their animals for microchipping, licensing.
Oh,
It's like a satellite clinic.
Oh, okay. So it's not like a party or something.
No, sir.
Not in a traditional sense.
It could be.
The previous contract actually called for 5 events throughout the city. And they end up doing, I believe, 9 events to get that 952 licenses.
It's good.
So the new contract we're working on right now calls for 8 events to get 1,500 licenses. My guess would be they'll probably do about 12 or 13 to hit that goal of 1,500.
Fantastic.
So
I hate to bug out, but I've got to leave. Go ahead and finish. I think.
Yep, keep going.
I think the manager will still be here. Thank you very much. Thanks for your work. Appreciate it very much.
Thank you, Mayor.
So strategy B is to develop a plan to further improve animal response operations. And so the first slide here is, again, from the resident survey, looking at satisfaction over time through the first 3 quarters of this fiscal year. It's very steady from last year for both enforcement and animal code and customer service. So these are both areas where satisfaction is relatively low, but there's a very large neutral on both, and the dissatisfaction is ranges from about 15% to about 22%.
If I may talk briefly on that, the one that is particularly troubling to me, the enforcement aspect of it, it says 36%, 41, since the audit. We have not, I know we've completed 15 of the 17 recommendations, and staff, to their credit, doing everything the audit calls for. And if you look at the, back in 2017, we used to get complaints all the time, those high-profile Facebook type blown-up complaints. The last time I can remember we actually got such complaint was back February of 2018, to my knowledge. We haven't received it so far. And staff, pretty much doing the inspections and re-inspections have been followed up on. So I was hoping actually for these numbers to slightly increase.
Well, I think this is probably an ongoing communication. I think we wrestle with it. Is if it's kind of in area where there has never been, this has never been an area that has been a lot of focus of citizen concern when we rank it into the IS survey. People are generally not worried about animal control services in this city. But I think that also means that we struggle to get the word out about the quality of work that we're doing. So, I mean, I think you look at that FY 16-17, if I remember right, we started doing a little kind of promotional outreach, doing some Channel 2 video communications, doing some of those outreaches in that 16-17. And then we saw kind of an increase, and then we moved on to other areas, and you can start to see that trend back is, to me, this is all about marketing. I think it's not a question about the effectiveness of the program. I think this is just more of a getting a good word out there about what we're doing. And I mean, we've beat our head against the wall a number of times trying to figure out. It's the same issue with, we've got the tools from free smoke alarms, yet every time we have a fire fatality, it's like, how do you get the word out when you can say there's no reason why you shouldn't have a working smoke alarm in your building with a free smoke detector? So it's that, how do you get that communication out, and how do you get the public to weigh in on this issue? So I don't think it's anything that animal control is doing wrong. I think it's more about how do we get the word out about what we're doing right, all the good things that we're doing right. But I think that, Kate, do you see any? I think, to me, this has always been kind of a marketing issue.
Yeah, I mean, and I think the next slide, and Patrick can talk more to this, I think that this also potentially will lead to good returns down the road, because the response times, based on some of the changes that animal control has implemented, are dropped pretty significantly. I mean, and another factor that I think, and we don't have this data in here, which I have to remember to bring it for next time, is that I think the most common singular call is for stray dogs, and I think we still have about a 50% unable to locate rate. And so that's another thing I think that we're up against is, for all the people who are calling for stray dogs, then they may see the stray dog again. And so that's just a challenging problem.
Moved in 10 years.
No. But again, maybe the response times coming down may have some impact on that. I mean, still, a dog on the loose is going to be moving continuously, so that's a bit of a challenge.
Getting back to the communication issue, we've done the YouTube video with council people, the mayor, et cetera, Congress, flavor, you name it, and we're continuing to work with public information officer and try to get the word out. So we'll keep doing what we need to do.
Yeah, and I think we probably need to, take advantage of, because we had an unusual case a couple weeks ago where we had animal control had to respond to, what was it, duck?
Horse.
Horse.
Correct.
A turkey in City Market.
The turkey. I mean, those are the kind of stuff where,
Yeah.
yeah, those are the kind of stuff that will kind of register. We probably always ought to take advantage of those just to make sure that the uniqueness and the always changing environment that we have to deal with. It's more than just running after Fido who's gotten free. It's more, okay, we have a turkey in the city market, or a 10-foot long boa constrictor, and, I mean, under a porch, an alligator. I mean, those are the varieties of spice of life around here, so.
And that was actually on the local news.
Yeah.
The turkey event.
Yeah, and so we probably just need to always make sure that neighborhoods is always promoting that anytime there's an incident like that, because I think it goes show to the quality of our officers and their ability to adapt to changing. It's not just stray dogs, feral cats. It's
And the instruction to staff, any event, like we just mentioned, the turkey incident, they do know to contact the public information officer, so we can highlight those.
Right.
Which we'll be doing later.
Always tell them that story.
Sure.
Yep.
Patrick, do you have anything else to say about the response times?
Sure. If you look at the number on creation to dispatch, 82, we look at the cases that came in March cases in February was about 1,022. Then we had 40% jump in March, 1,440. So I can see where that number actually went up, creation to dispatch.
What's your current staffing, Patrick?
3 vacant ACO positions. We have 14 animal control officers, 4 supervisors, 2 special investigators. Yes.
So are we able to keep the overnight position filled?
Yes, right now it's currently filled. We just have a new.
That's a huge issue on driving.
Yeah, and the drop that we saw in August, September, I think was partially due to some changes that Patrick implemented, both the overnight officer, but also staffing up, shifting some staffing a little bit to better align with the volume of calls. The last strategy is to engage pet owners in responsible pet ownership. And so just one slide here for Patrick to talk about there.
This is pretty much the events from last KCStat, I believe that was last November, showing the events that staff attended. As I've always mentioned, the animal control officers, they have part of their performance standards, one meeting per month. So these are the meetings that the special investigators who are tasked with doing more community events, these are the things that they've done within that time frame. They've made so many efforts to reach out to schools, but sometimes, schools are so busy, it's hard to get us in, work with kids, and we try to work around their schedule. But we'll continue to make those efforts to reach out to whoever wants us. Like I've always said, if you want animal control officer staff at your neighborhood association events, call us. We're here to educate. We'll do our part. Make sure we get the word out.
All right, that takes us to the end. So thanks everybody for being here. Next KCStat coming up first week of June is on customer service and communication.
Patrick, just a quick story. You guys, for whatever reason, a couple weeks ago, were parked up in the Northland on a Saturday. And and the family dog got out, as he occasionally does, and goes exploring in the neighborhood, which usually means that I have to go out and explore the neighborhood to find the damn dog. But I will tell you, because of your presence down there in the elementary school, I was able to remind the dog that if he kept running, I would just turn him in back where he came from a long time ago. He immediately stopped, got back in the car. So the power of prevention is well and aware. So pass along whoever was up there. They were just sitting in the parking lot at the school waiting for calls, but it worked. My dog was sufficiently kowtowed to get back in the car.
Ready to always go to see the staff. Do a good job.
Thanks, everybody. Appreciate it.
This is a project that has been